My name is Dawn Seek. I'm the Executive Director of the Maryland National Capital Home Care Association and also the Emergency Preparedness Network. If you don't know anything about MNCA, MNCA is a trade association for home care, home health, and durable medical equipment providers in Maryland and DC. I do come from the provider world. Our goal as an organization is to provide education, lobbyist support, and also networking opportunities for our members. During the pandemic, we were very lucky to get additional funds from the Office of Preparedness and Response, who also funds all of our normal website operations. We want to say thank you to them for providing this, the funding for us to be able to provide these webinars to you today. If you are not aware, the Emergency Preparedness Network is a free network that you can join. We do have a website, which is listed right here. There are many, many handouts available for download there. Many of them are on COVID-19 and different educational topics, but there's also many other emergency preparedness opportunities that you can download and print out. And if you work with patients, you can hand those out to your patients. There's also a resource guide for home care agencies to use to create their own preparedness emergency plan. Also with MNCA, again, we are a trade organization. What I always say is that we exist for our members and by our members. If you are in the home care space and you are not yet a MNCA member, please check out our website, look at the offerings that we have there. If you have any questions at all about membership or anything else, please see my contact information here. I'm happy to answer any questions that you might have. Additionally, I want to thank Charlene Brown and Learn Care Together for spearheading this very, very important webinar series. Also want to, before I introduce Charlene, I want to tell you a little bit about some of the upcoming workshops that MNCA does have. We have an event coming up on July 8th, which is the State of Home Care in Maryland in 2021. And that's put on by our partners at Home Care Pulse. That should be very interesting for anyone who works in the home care space to give you an update on what's happening in our industry at present. Also, we have a very exciting event coming up in October 20th at Turf Valley Resort in Ellicott City, Maryland. And this is going to be our first in-person event since the pandemic. And this is our annual meeting. And this year we have a very exciting speaker. Her name is Donna Cardillo, and she is a nurse that understands the home care industry. And she's going to start off this event with a little bit of entertainment and brevity around working in the home care industry, but also to give us a little bit of information about what she sees the future looking like. And then we have a host of other speakers that are going to talk to us about what's changed in home care since the pandemic and what the home care industry will look like moving forward. Additionally, we have more EPN websites, workshops coming up, assessing and addressing mental health needs of older adults living independently and supporting their in-home caregivers during COVID. And these are very important topics because we know that this has been an extremely stressful time, not just for the patients living at home, but also for the caregivers that have been caring for them. So this is an opportunity for you to learn some techniques to support those people, both the patients and the caregivers. So please, again, this is another free event, so feel free to sign up for that. And then last but not least, how to increase caregiver vaccine confidence by our very own Dr. Charlene Brown, coming up on June 23rd and 24th. And again, to sign up for these events, please feel free to go to the Emergency Preparedness Network website and go to the events page and sign up there. And last but not least, I'd like to introduce my friend and colleague, Dr. Charlene Brown, who is the founder of Learn Care Together. She has again spearheaded much of our emergency preparedness content over the last year and a half, and for good reason, because she comes with a wealth of knowledge from the public health background. And we're very, very fortunate to have her as a friend of the, not just Minka, but also of EPN. So with that said, Charlene, I'm going to turn the presentation over to you.
I'm Dr. Charlene Brown. I'm a board-certified public health physician and entrepreneur that has spent the last 5 years really focused on the professional caregiver workforce. So that includes nursing assistants, home health aides, personal care aides, working on different businesses that focus on improving their life outcomes or health outcomes, and most recently, increasing uptake of the COVID vaccine. Before I was an entrepreneur, I was a public health leader. I was the former Deputy Health Commissioner in Baltimore. I worked at the FDA, USAID, and most of my career was really focused on pandemics. And so it is my honor and my pleasure to be here today and to share with you the lessons that we've learned across various settings as we move towards increasing uptake and confidence around the COVID vaccine for the betterment of all. So let's launch into the first part of today's agenda, which is going to be understanding vaccine hesitancy. So vaccine hesitancy is exactly what it sounds like. Basically, you have the World Health Organization. There's a strategic advisory group of experts on immunization that put out this global definition of vaccine hesitancy a couple of years ago, long before the pandemic. And they described it as the delayed acceptance or refusal of vaccines despite vaccines being available. And the World Health Organization considers it to be one of the top 10 gravest threats to global health. And that was before COVID. You have people, I'm sure you all have people that you've worked with who immediately and unambiguously wanted to be vaccinated. And then I'm sure you have people who are absolutely adamantly refusing to ever get vaccinated. Hesitancy is really in between, the people who are deciding between vaccination and not getting vaccinated. The anti-vaxxers tend to be a very hard group to convert, and you don't really need to convert the people who are pro-vaccine. So we're going to focus a lot of our efforts and attention on the proportion of the population that is hesitant. So there's a vaccine hesitancy model called the 5 C's: confidence, complacency, constraints, calculation, and collective responsibility. This model, if you put it in context, it really captures the thinking of people who are, they're considered the psychological antecedents to deciding to get vaccinated. And so we're gonna go through them one by one and then think about the context of the folks that you're working with that might be hesitant and where they fit on the spectrum of the 5 C's. So confidence. I'm sure you've heard, like it's all over the news, vaccine confidence, increasing vaccine confidence. I talk about increasing vaccine confidence. It really boils down to, do people believe it works? Do they think it's safe? Do they think it's important? And do they trust the system that's administering the vaccine? And so if you think about the concerns that caregivers express about the vaccine, are they experimenting on me? Are they going to mess up my DNA? Is it going to affect my fertility? Is it safe? Is it going to kill me? Why didn't you test it on animals? Like, all of these concerns are rooted in a lack of confidence. And how do you move forward without confidence? If you don't believe it's safe, if you don't believe it works, or if you don't trust the system, there's a whole group of people who really believe that the vaccine is part of a conspiracy by powerful people to create a one world order where they dominate the less influential people. Like, if you don't trust that that's not happening, how do you move to a place where you can even listen to people talk about all the benefits of the vaccine? Next is complacency. So people are complacent. They're not necessarily worried about safety. It's a big deal. These might be the people who were going out to nightclubs at the height of the pandemic. Think of people who have a very high risk tolerance, people who are risk takers, they can sometimes fall into this category because they don't really think it's going to happen to them. And if it happens to them, they think it's not that bad. Maybe they've had friends who've had COVID and it wasn't that bad. Maybe they had COVID and they were asymptomatic. They just don't think vaccination is necessary and they're comfortable with risk. Then there are the constraints. Now, you know, if you can't get time off to go get vaccinated, I bet a lot of you had caregiving professionals who were struggling to even find an appointment back in the earlier days when it was harder to get an appointment to get vaccinated. For many people, they don't have transportation, it's not convenient. Maybe they don't speak the language and they're struggling to make appointments. All of this falls into the category of constraints, but you don't really ever get to constraints if you don't have confidence in the vaccine, because you're not going to bother making an appointment or caring about whether or not you have transportation. So the model has 5 C's, but in my opinion, the first C, the C of confidence, is a prerequisite for many of the other C's. Now, this whole model was described by Caroline Betsch back in 2018 as a framework for thinking about vaccines. And this was, again, before the pandemic. So this whole concept of hesitancy and addressing vaccine confidence existed before the pandemic. It's just gotten a lot more attention because of the scale and scope of the COVID pandemic. Then we have calculation, right? These are the people who are weighing the pros and cons. They are assessing, you know, am I really going to get sick? Maybe they think they wear PPE at work and, you know, their behaviors are pretty safe and they don't really think it's going to happen to them. Maybe there are others who are more worried about getting infection, but then they're weighing it against some of the things they've heard about the vaccine being dangerous. Like this calculation process is something that we all do to different extents, but there are opportunities. If you think about each C creates an opportunity for intervention. So once you figure out where the people or persons that you are working with on vaccine hesitancy, if you figure out where they fit, it enables you, it makes it easier to design interventions to address the hesitancy. The final C is collective responsibility. And this is that sense of, I'm going to do it because it's good for other people. It's good for my clients. It's good for my family. I want to protect my children, my friends. I've spoken to a lot of folks at agencies who wonder if I just tell the caregivers that clients want vaccinated caregivers, they need to do it to protect their clients. Well, that might work for a subset of caregivers, but again, if they aren't confident about the vaccine, addressing constraints or collective responsibility or helping them to calculate the risk, all of this is contingent on believing that the vaccine is something that's safe for them. So I'm going to pause there and I'm going to stop sharing so I can see your beautiful faces. And if you have any questions about the basics of vaccine hesitancy and the 5 C's.
So I might have missed this connection. The 5 C's, where does that model come from?
It's a model produced by scientists, essentially. Literally that model was published in 2018 by a scientist called Caroline Betsch, who studies vaccine hesitancy. And originally, before 2018, it was called the 3 C's. And she challenged that model and said, no, there are actually more psychological antecedents to the decision to get vaccinated. Okay. And so she published an article about the 5 C's, and that's really taken root as a core framework for thinking about vaccine hesitancy and what the considerations are around vaccine hesitancy. But it's at the end of the workshop, like after we're done, we'll send out the presentation, access to the recording, and we'll also share a resource list, and I'll include that article on the resource list.
That's great. Thank you.
Great question, Carmel. Do other people have questions? Have you noticed any of those 5 C's applying in your environments?
Yes, I have. And thank you so much, Dr. Charlene. That was great information. And you answered my question because I was like, oh, I want that PowerPoint presentation because we're working on a vaccine incentive program here in Oregon. Now, this is really early, so I really wanted to participate in this workshop. So thank you for having it. And the sun is shining here in Oregon. Thank you.
Isn't it 6 a.m.? Like 6:20?
It is. I had to set my alarm to get up in time for this. So yes, it is 6:24 a.m. in Oregon.
Okay, so everyone celebrates your dedication to vaccine confidence. So welcome. Does anyone, thank you for that comment, Cheryl.
I have to say, we have a lot of folks that are hesitant because of either political reasons or religious reasons. And so we've had an initial group of people who have been vaccinated, but we're still trying to develop ways to reach those communities that are hesitant. And our data aligns with some of the information that you provided. Younger people, surprisingly, are a group that are more hesitant. And then just sort of that conspiracy theory group as well. We've just done some data research, the union has, and they provided me some of the work that they did, and it just aligned right with a number of the points that were provided in your presentation.
Well, thank you so much. That's wonderful to hear. And yeah, the religious objections are a tough one to challenge. I spoke to one agency owner in Maryland who described a pastor. She has 6 caregivers, caregiving professionals that work at the agency that all attend the same church. And they have a pastor who has declared that women do not need the vaccine, that the vaccine is for men, and that women should not be vaccinated. And so all 6 female caregivers are not getting vaccinated because of this pastor. And it's not only, we're going to talk a lot about trusted messengers and how when you trust the person who's sharing a message, how powerful that message can be. And in that case, the pastor is the trusted messenger. And unfortunately, he's messaging something that's just not true and is quite dangerous. For today, I'm really excited to talk about getting to 92%. So Keswick Multi-Care Center is a skilled nursing facility plus much more in Baltimore. They hire nursing assistants, which has significant overlap with the workforce working in home care. And that organization was able to get to 92% COVID vaccination coverage as of last week. 92%. I think it's phenomenal. And that's why we've invited Ms. Carmel Rokes to talk to us. She is the CEO and president of Keswick. She is one of my favorite people and has this remarkable 30-year career leading and repositioning senior care organizations. So her contributions to the field far exceed what's written down here. But just to review, she has many areas of expertise. She's a licensed nursing home administrator, licensed clinical social worker. She's had many, many leadership roles. But what's most relevant for this audience is that she has home care experience. So she was the director of home care and adult daycare for Catholic Charities of Baltimore. And so we've invited her here to talk about the approach they took at Keswick and help us translate the lessons learned from the approach you can take in a long-term care facility to the approach you can take within a home care agency, given that the workforce is so similar. So thank you for being here today. She's a board member at Lifespan Network, Greater Baltimore Committee, so on and so forth. And again, this is like a teeny tiny snapshot of all the things that she's done. But we're gonna stop and I'm going to search the beautiful faces to see if Carmel can.
I'm here. Can you see me?
I can. What a beautiful backdrop today.
My office, and the most important part is the map of Baltimore. With all the zip codes and the tiny neighborhoods, which we're going to talk about, micro interventions.
Absolutely. Well, thank you for joining us, Carmel. Why don't we start with you telling us just a little bit about Keswick Multi-Care and what kind of skilled nursing facility is Keswick and what makes it different from other skilled nursing facilities?
So first of all, I'm so happy to be here with all of you. And Charlene, thank you for that introduction, and right back at you. So Keswick is a 242-bed nursing home, which makes us one of the larger nursing homes in Maryland. And the folks that we care for come from sort of the northeast region of Baltimore, but sometimes beyond, depending on which hospital system they've been associated with before coming in or where they live in the community. Most of our residents in our nursing home are poor by virtue of having become elderly and sick or have had lives of poverty. And more than half of the majority of our residents are elders from the African American community in Baltimore. Now, we have kind of a unique organization in that Keswick's been around for 135 years, and we have an endowment fund that's grown into a significant foundation, and it has supported our nursing home and our adult day program to really provide what we believe would be programs and amenities and physical environment to support quality of life for people. So we have all private rooms, and we've had all private rooms since the buildings were first built. We have a lot of, in our trade, what we would say is non-revenue generating space, which means we have an auditorium and a chapel and an art studio, a very big rehab gym, and lots of space for people to communicate and mingle. And we're able to do this because all of you know that Medicaid does not cover the cost of care in Maryland's nursing homes, and Medicare just barely covers it. So we're able to make this happen because our foundation provides this grant, this subsidy every year to make sure that we can have just the best of the best for the people who we are, so privileged to be entrusted with their care. It positioned us when we entered the pandemic a little differently than other organizations, because it meant that we were able to afford to do things like go out onto the black market and buy PPE. And we were able to pay COVID pay to all of our employees, not just our clinical staff. We were able to create a separate COVID unit for people who were positive and had the disease and were active in the disease process. We were able to do things like provide transportation for our staff who typically would ride the bus, and that was a dangerous thing for them to be doing. And so I'm really aware that we sort of started out our pandemic experience in a different way than a lot of organizations, but primarily what it allowed us to do was to be able to say to our employees the most important thing. And I'm the one who was saying this to them, and then this was pushed out through the organization. The most important thing is your health and well-being, because your health and well-being is what our residents depend on for their health and well-being. And so keeping you safe during this terrible pandemic, and it extends into your communities and your families, is our primary goal. That's what we want to have happen. And then because we were fortunate enough to have the resources from the foundation, we could then do things that demonstrated we were absolutely going to walk the talk. And our employees had some experience of that being true anyway. So there was trust there, but we had trust built in because of this relationship with our employees. And I said in one of the previous workshops, I think culture, leveraging culture in your organization. If you have a culture that's based on respect and appreciation for your employees, your staff, is one of the really potent things that you can use to begin to have some impact on vaccination hesitancy. And then the whole other thing we do besides our inpatient service lines, of course, is we're in the community, very active in the community with community-based programming. And we took the same approach with our Keswick Community Health Programming as well, and worked with our local providers to go into people's homes and try to make a difference.
Well, that is incredible. Keswick went above and beyond to really care for its workforce during the pandemic with resources that a home care agency typically would not have.
Right.
And so why don't we take a step back and look at how you decided to approach offering the COVID vaccine to your staff once it became available. I know that in our conversations, you told me that you anticipated that there would be some hesitancy. So what are some of the steps you took even before you launched vaccination to introduce the concept of getting vaccinated to your staff?
So one of the things that we did was, when the state declared an emergency, we went into that emergency mode. And so we spent a lot of time, the leadership and management team talking together about kind of trying to sort through how can we approach this in the best possible way. And we knew, because our staff come from some of the hardest hit communities with COVID, very high death rates, very low support of any kind from systems that we would hope would be more supportive. We knew that there was a likelihood that our staff weren't seeing a lot of people in their communities taking the vaccine. There was vaccine hesitancy in their home communities. And we knew that they weren't going to take the vaccine just because, like, we told them to. So we started with the assumption, this is not about mandating this and shaming people and browbeating them and you must. We started with the idea that, and I learned later, Charlene, we were like right doing the public health thing really well, just based on sort of an intuition about our relationship with our staff. We thought, we got to give them, we got to kind of warm them up. So we started putting posters around that sort of celebrated the vaccine being available. And we started talking first in very top-down kinds of meetings where this is a mandatory, all staff meeting, and you have to come to this one meeting. This is the one thing you must do. And we're going to give you some handouts that are in simple lay people language, talking about the vaccine. And, you at least will have that basic information. And then we took the approach of, we need to be able to gather with our staff in much smaller groups where people would feel more comfortable saying what was really on their mind. And so we did that. We did team huddles, and we did, and when I say we, I deliberately stayed out of all this because my thought was the last thing, beyond the work that I did and just my visibility around it, I didn't want staff to feel intimidated by the CEO being there. So these smaller groups and these sort of team approaches were with people's direct supervisors or managers. And then we moved it even further, and we identified folks, and this is where this, trusted messenger model is so effective. We identified people on our staff who the other staff members were comfortable talking about what they felt and what they knew or didn't know, and asking questions, and, sort of having a chance, a safe space really, to feel respected and comfortable while they process this. I think we figured out that as much as the facts about the vaccine, providing the opportunity for people to really process what they were hearing, what they were feeling, what they were seeing in their home communities, what their friends were saying at work, you know, what their pastor was saying. We knew that people needed time to process that, talk about that, and to feel supported in that. Like, that's a really important, legitimate thing to do. Not sort of, I don't know why you're making such a big deal out of this, you know. So we did a lot of this warm-up stuff a couple of weeks before. Actually, we had almost a month before we knew we were going to get the vaccine. And then we scheduled the clinics on campus. And Charlene, stop me at any point if you want me to talk about another part of this. But we scheduled our clinics, and you know, people had to sign up for them because, you know, you only got a certain amount of the doses. And so we had the Pfizer vaccine, and we were working with CVS, who really didn't quite understand mass vaccination as a process, but that's okay. We got all set up, and we made the day of the clinic festive and kind of fun and relaxing. And we had actually the experience of seeing people who had not signed up to get the vaccine see their friends getting the vaccine and deciding that day that they were going to get vaccinated, that it was okay. And in some cases, it went way beyond just seeing their friends getting vaccine. And, you know, I was down there, and the whole management team was down there, and we were trying to be as helpful and supportive as possible. And the person checking them in knew everybody's name. So we have 300 staff we vaccinated. Knew people by name, knew which unit they were from, and that helped. But I actually saw nursing assistants take other nursing assistants' hands and walk them in and sit with them while they got their shot and comfort them and tell them it was going to be fine. And there was, you know, like my saying, I got the shot, it's okay, just didn't matter compared to a coworker doing that with them. So we moved on to try to use that as much as possible in encouraging our staff. And, you know, as we continue to go along, we had a second clinic. So we had people the first time said no, but they watched what happened to the people who were vaccinated the first time. Some of them, you know, went home and talked to trusted folks in their home community, I think, and that helped. And so the second clinic, we picked up a lot of the stragglers the first time around. So they had that period of time to continue to process and to talk to people they could trust. Our medical director was wonderful. He's on site every day. The staff work with him regularly. He's a person of color. He did a little video for people who couldn't come to actually visit with him. He made himself available to talk with anybody who wanted to talk about their concerns. And we still have some people who have said, I'm not getting vaccinated. I'm just not doing it. And we've gone out of our way not to shame them or browbeat them or make them feel like they've done a horrible thing. And I'm starting to see that happen. You know, as we've gotten further into vaccination, I see some other situations, not here at Keswick, where people are getting treated poorly because of their choice around this. And it just doesn't pay off. I think when you do that, people just feel more isolated and othered and more likely to just stand their ground on this. So that's kind of a lived lesson, you know, just watching that dynamic and understanding people who don't want to get vaccinated, they have their own good reasons for not wanting to get vaccinated. And I think the emphasis there is good. Their reasons are good reasons. They're good reasons for them, even if they contradict science and all of that. And you have to kind of start there with people. So that was very effective for us. And we didn't have to pay people to get vaccinated. We reduced all the barriers you know, by it was here, it was on site, it was made, it's free, you know, we loved people up, but we didn't have to do other kinds of things to get that vaccination rate so high.
You mentioned that the medical director served as a messenger sharing information about the vaccine with staff, and that it was, as a medical director, he's a physician.
Right.
You also mentioned that he had relationships with the staff. Do you think that bringing in an expert physician, if he hadn't already been connected to the staff, would have been a powerful way to influence nursing assistant decision making about getting vaccinated?
That is such a great question, and I'll share my personal lens on that. My employees are almost all African American or African, and they live in Baltimore, and they come from a city that has a very, very difficult and challenging history when it comes to the healthcare system and its treatment of people of color. So I think you know, it's why, as an old white lady, I understood I would not be the trusted messenger. I mean, my staff know I care for them, I pay attention to their lives, but like, I don't live in their neighborhood, you know, I have a different life experience. I'm a privileged old white lady. So me getting up and saying, oh, you should get the vaccine, had limited impact. Dr. Saluja had more impact, I think, because he already had a trusted relationship with the staff. So it wasn't so much that he was the expert, although that mattered to some people. I mean, like, they trust his knowledge. But it had more to do with he already had a good relationship with the staff. Many of them are his patients. So I don't think just any old expert showing up and saying, this is good for you, you should do this. You know, it's like Dr. Fauci, yada, 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 you know. People, I think, were much more likely to listen to him because of his relationship, his prior relationship, which all goes back to this, the micro interventions, the trusted messenger intervention, the relationship intervention is the most powerful tool we have. And as a public health person, you know, Dr. Brown, I know I'm preaching to the choir. This is how care is provided across most of the world, with trusted community health workers going in and, you know, working in communities with the community elders or whoever, you know, to get some uptake. And so we sort of saw a microcosm of how that can work in the nursing home. I know that our home care agencies have a totally different experience, having run a home care agency and an adult day program, where you don't necessarily have that ability to gather staff to provide the resource for them in a kind of low, you know, barrier way. So I think it's all that more important that you try to find the people on your staff who can influence other staff members and almost buddy them up if you can. Figure out, you know, give people a peer buddy who's informed enough and comfortable enough talking about things to help them through that. I think using something like a video from a trusted care provider who they know might help. You know, I think there were people who watched the Dr. Saluja's video who that was how they got their message. And probably they watched it with their neighbors and their family. And then they all chatted about, was this a good idea? So I think that you can leverage technology a bit, probably. And then the thing that I'm focused on right now and talking with some folks in Baltimore about, because we were fortunate to get a Rockefeller Foundation grant to do this work, which is these micro interventions in literally, you know, a block at a time. And I'm talking with the people who are doing that work about, can you is there a way you can let me know, or I can find out where these micro interventions and targeted kind of things are going on in people's home communities, so that if my staff live there, I can kind of put that forward as you know, a resource for them, because it's different when it comes from people in your community. And what we've been up against is our staff lived in communities with very low vaccination confidence, very high rates of death, very low rates of PPE testing, you know. So that had to be kind of overcome in some way. And I'm pretty sure that's probably true a lot of the home care staff as well.
Yeah, you are correct about that. The hesitancy cuts across senior living and home care, and it's a real struggle for agencies who are working to increase vaccine uptake in their frontline staff among the caregivers that work with the families that are their clients.
Mm-hmm.
As I was listening to you talk, there were a couple of things I wanted to invite you to describe in a little bit more detail. One, you've used the term micro intervention, and that's a term of art. If you could clarify what you mean by I mean, obviously micro intervention, small intervention.
Well, so, you know, one of the things that my bias toward community and home comes up when I talk about this, because our hospital systems decided that they were going to be really helpful, and they were going to bring mobile units into neighborhoods for vaccination. And there they were, you know, in the neighborhood waiting for people to come get vaccinated. And there wasn't like a big surge of people like thrilled to see them and running up to the hospital, you know, van to get their shot. And I thought, well, okay, so that didn't work really well, did it? So the issue was they hadn't gotten to the next step, which any good public health person would have told them. You have to go talk to the barber and the beautician and the pastor and the granny. You know, a lot of blocks have a granny. And, you know, and literally block by block, figure out who are the influencers and talk to them about helping people get vaccinated, because people aren't going to come just because you showed up with the vaccine. And so that's the kind of, it's very targeted. It's like, and it's based on, you have to actually get, you have to actually get into the community and talk to the people who live there and let them tell you, instead of having an assumption about it. So it's getting more and more refined in that regard. This recognition that, you know, these are communities, they have leaders, they have a whole highly developed social network. And if you go talk to somebody, and usually it's the church pastor who can really help you get it rolling. Sometimes it's the barber or the beautician or, you know, somebody who does daycare, you know. So they'll tell you what you need to do or how to go about it, and they can be influencers. And so that's the more micro targeted, you know, intervention that's starting to happen in some parts of Baltimore because of this additional funding that came through.
Wonderful. So now let's translate all of this into the industry in the world of home care. When you think about a micro intervention and you're describing sort of outreach or community-based efforts that are going to be beyond the scope of what individual home care agencies can do, but you also described a series of micro interventions that you implemented within Keswick, so within an organization. And I'd love to hear if you take off, like put your Keswick hat on the table next to you and put back on that home care hat and I'd love for you to process out loud some ideas about how to translate the strategies that worked in the long-term care workplace that people attending the workshop can take with them and explore applying in the home care workplace?
So I think what I would do with my home care staff would, one thing that would be similar would be to have a very clear North Star. Your safety is the most important thing. Now, if that is a lie, or you don't really feel that, saying it is not going to help. But if you truly believe the safety of your staff is the most important thing, and you can say that to them, then say it. Be explicit about it, be direct about it. And then I think this idea of beginning to push information out, but in a very low-key, sort of non-threatening way. One of the things I talked about in the last workshop was we avoided using people images with the messaging about the vaccine because we were trying to neutralize some of this sense that many of our staff have, which is, oh, you're just, I'm a Black woman and you're going to experiment on me again. And if the poster has a happy Black lady on it getting experimented on again, that's a big turnoff. So we did things so that the posters had animals and cartoons and different kinds of visuals that went with the message that being vaccinated, can bring you a sense of security and comfort, the good things. And just getting that sort of out there. So I think you can do that. You can either do it virtually with your staff, with their, iPhones or cell phones, or you can do it with actual hand, stuff. I don't know if you send your folks things by snail mail or however you want to do it, put it on the website. So I think that's something that would work with my home care staff. And I think the other thing that would then work is, and this, I would use my scheduler, because we used our scheduler at Keswick, who is the person who structures this, sends people their assignments. And so she knows the staff. Frequently, she's the one they call off to, and so there's a whole, she knows, that their kid gets off the bus at 3 and there's no way they can take an assignment that's going to interfere with that and those kinds of things. So I would probably try to leverage my scheduler if I can. Now, I'm assuming that most of our home care providers use a scheduler in that way and that it's not all electronic. If it is all electronic, you're just going to have to bite the bullet and use the technology that's available to be able to text and message, and to use that to send the same message about wanting them to be safe, trying to find information that lowers their lack of knowledge. So, bits of information, not all at once, a big thing that the CDC and this is and that, just very simple sound bites of information that you can push out. And then the other thing that I think is, we lowered the threshold for the aggravation and difficulty around getting the vaccination because people could get it right here at work. They didn't have to go take off work. They didn't have to drive someplace. It was just come to work and, we'll send you down there when it's your turn and get your shot. So I think about for my home care staff, I would want to find a way I could lower the barrier around that. This gets dicey, but you might want to consider giving people some time off. You definitely want to find out where the most convenient sites are for getting vaccinated and give them that information. So that's some work that the internal management team can do on behalf of staff. And then I think, and this depends on how well you know your staff, or if you're in an organization that has multiple layers, because you have a big home care staff, who knows who? Figure out who knows who, and see if you can pair them up around talking about the vaccine. And I would suggest not even talking about getting the vaccine, just encouraging them to talk to each other about the vaccine. And it might all be, I'm not letting, Bill Gates put a chip in me. Well, neither am I, because it's going to affect my baby. You can, whatever it is they want to talk about, but start with pushing them sort of toward each other. And then if you have people on your staff that are not vaccine hesitant or have overcome vaccine hesitancy and are willing to learn how to talk to other people about it, I would say as a home care manager, it's worth its weight in gold. And in fact, you have to pay some gold to pay them extra to learn about it and to be the champions. And I think those are things that I would do.
Okay, thank you so much. That is wonderful feedback. I'm going to transition to open the floor for questions, but before I do that, do you have anything else to add that you think will be useful to this audience that I did not ask you about?
I don't know how useful it is to know, and I know, Charlene, you're going to teach about this, that having a trusted messenger, whether it's from somebody's neighborhood, community, family, church, whatever, or at work, a trusted messenger, is the single most effective intervention. I know that I have people who took the vaccine who still don't believe anything about the vaccine. They don't understand the science. They are not entirely sure it isn't going to change their DNA or whatever else they've heard. But they took it because their friends said it's okay. It really is okay. Look, I'm okay. Nothing happened to me. You're going to be okay. And so in a very weird way, the facts don't matter. The messenger matters. And I just think we really experience that. And I think it's true in home care. I think it's more of a hurdle to get the connectivity, which is why I think I know the margins are very thin, but I think it's a worthwhile investment to try to identify champions and pay them a little extra to be champions, lift them up, elevate them, and value what they're doing, because they're going to help the company be successful.
Absolutely. So thank you for that. Let's open the floor and invite questions. We're a small group, so you can raise your hand or you could literally just unmute and start talking. All right, Gary Fink.
Hi. Thank you, and thanks for that wonderful presentation. My question is, how differently or similarly would an organization approach employees if it is going to mandate vaccines, if it's a healthcare organization? What should or shouldn't be done in order to maximize comfort, to minimize stigma, if one is going to mandate?
I just think this is the question of the hour right now, because, in Baltimore, our major healthcare systems who employ thousands of people mandated vaccination for all of their staff. And it sent ripples through the world of healthcare here. And I am pretty sure that the nursing home sector is teeing up to do the same thing. So I'm going to get on my soapbox for a moment. I don't know that this is helpful, but this is the lens I look at that through. As a regulated, licensed healthcare provider, my duty is to protect my staff and my residents. But my primary duty because I'm regulated and licensed, is to not do anything that endangers my residents. And so it's very, very hard when I have to weigh, and I'm going to talk about the harm to staff from mandating, when I have to weigh my sacred duty to keep the residents safe from harm, never mind all the bad stuff that can happen if you fail to keep the residents safe. Never mind the negative outcome for the resident. When I weigh those two, I come down on the side of I have to protect my residents. And this is a tool that allows me to do that. When I think about my staff, and I just want to say I'm speaking for myself, I'm not speaking for my organization, I'm speaking for my take on this. Because my situation is that my staff is have been in a society that has not valued them or their work forever. The mandating of the vaccine is just one more experience of being kind of slapped in the face. And there's already a lot of trauma for that community of caregivers. And I think it intensifies around being told, no, you have to take this experimental drug, period. And now I'm going to interfere with your ability to have the dignity of work and perhaps pursue your vocation as a caregiver by telling you you have to take an experimental drug. And when you say no, you're going to lose your employment. So that is a horrifying thing we're kind of faced with. And so when I think about it that way, once again, all I can do is my best to help reduce vaccination hesitancy and help them voluntarily accept taking the vaccine, but understand it's a traumatic experience for people. So thinking further down the line, how to respect that and listen to that and be ready for that.
Right.
But I think if you don't understand that is what is happening, then you just sort of are jolly going along. And, I think all of us are going to lose some of our most sophisticated, very best staff. And that's really sad. Maybe they'll come back if it's not experimental and they feel like it's really safe, and be willing to be vaccinated. But there are people who are just going to not do this. And it's terrible. It's going to mean they lose their employment. I think that's what we're going to face at Keswick. So many of my staff are vaccinated. I don't think very many of them are going to be in that situation, so I feel better about that. But that's not true, across all of the healthcare sector. Did that make sense?
Yeah. The premise of the question was exactly that. It is going to be a traumatic imposition. And so for those organizations that do that, the question is how to best, as much as possible, ameliorate the trauma, address it, what to do given that, to try and minimize the impact and the negative effects of that. So, yeah, exactly.
And I think, acknowledging that it's difficult to the person is just shows respect, and some empathy, and that helps reduce it a bit. That you're acknowledging this is really difficult and we feel terrible. And then I think making sure it's understood the door is open for return, that, you're not going to be scapegoated or, taken off the list or whatever, that they can, if they change their mind or things change with the vaccine itself, that they're welcome. But I already see, as I said earlier, I see some scapegoating and kind of stuff going on already. And it's sad. It's hard.
Thank you.
Mhm.
Thanks for that great question, Gary. Are there other questions for Carmel on that topic or any of the other topics that she brought up?
So no one thinks, how much should we pay them to be?
This is a little bit on the same lines of the scapegoating, and because we definitely have a few caregivers who, you know, won't do it. And I definitely have been very clear that I respect, you know, it is your decision and we respect that. But I do have clients who have been pretty, I mean, I wouldn't say they're being disrespectful, but again, I think the caregivers, it just is a touchy thing. The caregivers, any mention of it, they think is pushing them to get vaccinated. And I guess if anyone, or, you know, you've experienced kind of how you handle working with residents or clients, and specifically, I mean, one of my clients loves her caregiver who doesn't want to get vaccinated. And so she doesn't want to get rid of her caregiver. But then they have this kind of ongoing discussion of the vaccine. And
I think that one of the things that you can do for people who have a situation like that, where they want their caregiver to stay with them, their caregiver doesn't want to be vaccinated, is making sure the caregiver knows that, okay, so you decided you don't want to be vaccinated, but there are other things that you can do to protect your client and yourself. Stay masked, you know, when possible, keep your distance, wash your hands, the things that they can do to try to keep their clients safe. If your client is vaccinated and they're masked and they're using all kinds of precautions, the transmission likelihood is much lower than if they're just buzzing around acting like, you know, we never had a pandemic. So I think making sure your caregivers who have the reluctance understand, now, you know, there are these other things you can do to protect yourself and protect your client. It's really important, since you've made the choice not to be vaccinated, that you do those things and just be very supportive in that way. I have family members of residents who yell at me because, you know, there are people who come into the building who aren't vaccinated. And, you know, we can't ask families if they're vaccinated. And we have to let our families visit. I'm so grateful that they can come visit. But I mean, it's a very dicey kind of thing. So, and, you know, they want me to put a stop to that right now. And I have a feeling a lot of your clients are like that. And then some just won't have some vaccinated. And maybe there's some education for them to understand, you know, you can so dramatically reduce the likelihood of transmission that, you know, it's way lower than before when neither of you were vaccinated, you know, and now there's some things you can do when you're vaccinated. If they wear their mask, yada, yada, you've created a pretty safe situation. I think people get a little bit very black and white about it. It's kind of all or nothing. And no, it's not, you know. So.
Yeah, it's funny, you know, they've been working together for a year, and then, you know, and throughout COVID, and then, and then this happens, and it's like, well, you know, there has been this risk for a long time, and now it is lower. And
it can stay very low.
Right.
And if you have some, Charlene, you probably have more facts about that than I do, but if you can then actually give them some facts about that. Like, well, now your transmission rate, if you have a mask on and she has a mask on and she's vaccinated, is, you know, 0.1. I don't know. I think that makes a difference. There's a lot of fear around this, mostly, you know, irrational. It's human nature.
Thank you for that great question.
Yeah, I loved it.
And
we don't see your name on the screen. What's your name?
oh, I'm Erin.
Hi, Erin. Okay, so thank you, Erin and Gary, for these great questions. Yvette, Baraket, and Jocelyn, do you have any questions for Carmel?
I came on a little bit late and I apologize. But I do see that Dawn Seek is on this call as well. And it was last week we had a private duty meeting of agency owners. I provide non-medical private duty care. I just checked in with my HR manager a short while ago because I wanted to know the percentage of my caregivers that have been vaccinated at this point. My numbers right now, which I feel is on the low end, but it's somewhat skewed because we've included a lot of caregivers that are not actively working on shifts,
Right.
but we're probably somewhere between the 30 and 50% range in terms of caregivers that have been vaccinated. And I just wanted to get a sense in terms of other folks who may be providing care in terms of what percentage of their workforce has chosen to be vaccinated and what tools or resources they've put into place to get those numbers increased.
That's a great question, Yvette. Carmel, why don't you at least provide context around the vaccination coverage you got at Keswick, since I think
So
everyone else, please jump in and share.
we did a lot of work around vaccination, and it isn't just our clinical staff, it's all of our staff,
Right.
our housekeeping staff, our dining staff, maintenance, groundskeepers, everyone. And Charlene, you had my most recent numbers. What did you say it was, 92? It changes bit to bit because we also must count in our count any agency staff that are in the building. So if we have someone who has a private duty caregiver, or we have an agency nurse or a nursing assistant, we have to count them in our count. And if they're not vaccinated, it counts against us. But our approach, we just took the broadest, most comprehensive, full court press toward helping our caregivers be comfortable with getting vaccinated. And a lot of it, I think one of the big differences really is that we were just talking about toward the end here, which is we could provide the vaccination for them on site at work. They didn't have to go. I had this wonderful person who was working on my house, and I said to him, why? He said, I'm not vaccinated yet. I said, why aren't you vaccinated? I was so worried. He has a new baby coming and all this. And he said, I can't take off work. And I thought, that's awful. That's awful. He has, he can't take off work and go drive someplace. And he's a person who can go drive someplace, to get the vaccine. And I was like, well, you should just leave my house where you're working and go get your vaccine right now. I won't tell, but so I think that's part of it. It's ease of access combined with opportunity to process.
On site, being right there, roll your sleeves up.
I think that's really hard for people.
Thank you, Carmel. Would anyone else like to share anything with Yvette about vaccination coverage at your agencies, or things that you've done that have worked or haven't worked as she works on increasing vaccine coverage?
I'll just say 30 to 50%. I mean, that's why Charlene's doing these workshops. That's not at all unusual.
Yeah, I definitely heard about a lot of other agencies, and I'm sure you have as well, that are struggling. Some are even still at 20%.
I think we're a small agency, and so I think we're at about 80%, and that is like, I don't think I did anything very creative, but I definitely drove. I think I drove like 10 caregivers to their appointments, because yeah, they just didn't have reliable transportation, and of course I kind of grouped them. Like I had 5 appointments at 3 p.m. at one place, and then 4 appointments at another time. But yeah, I think just like, and I definitely think I had one caregiver who was like, I'll get it. And I was like, okay, when are you going to get it? And then, I made her an appointment, and I was like, I will pick you up at 1:30. Like, we're going. And I do think, and she did it, like, like I do think kind of I was a little, I don't know.
Persistent?
Yeah, persistent, right? I guess I was trying to think of a better word. But yeah, I just really have taken that personal kind of approach with our caregivers. And I mean, we definitely still have those who do not want to be vaccinated, and I'm still working on those people.
Yeah, well, we see that we've got still a lot of work ahead to do. So these are that I like your approach, very hands-on. I don't know what I don't know if there's anything available to companies like ours where like we could arrange for somebody to come in from the county, and we can just where we can say, okay, we've got somebody here, come on in.
I know agencies outside of Maryland have done that,
Okay.
but yeah, I haven't found a way to do it here. But I mean, that would be a wonderful way to do it.
Charlene, are there any
Yeah.
resources out in the community, in the county, that will have a nurse come on site to, perform vaccinations? Do you know of anything like that?
How many caregivers? I think the volume matters. So in terms of like, are you talking about 10 caregivers or 200 caregivers? Do you know what I mean?
No. I would say, and we've got caregivers all over Georges County. But I would say that the number yet to be vaccinated is probably maybe around 40.
Okay.
So one of the things that we were able to do, and I don't know if this is statewide enough or countywide, but we actually were able to volunteer to be a community vaccination site. So besides separately the things we did for our employees, we've now done one. Well, we were doing Pfizer, so we had 2 clinics, and we have, I think, the J&J coming up in the next couple of weeks. So we volunteered to be a community site, and then the health department organized getting the vaccines to us. And
Yeah, Carmel,
I think if they do some stuff with the local hospital systems like MedStar also, So some of the same folks that are doing these vans, the mobile units, are kind of involved in this. You can become a site.
it's Carmel, this is Dawn. It's not that easy for a private duty agency because you have to have a CLIA waiver, which takes a little bit of time to get.
Yeah.
And as a facility, you have a lot more resources in order to pull that off, which the only thing I can tell you is that I talked to the Department of Health, and they were having agencies sign their employees up in bulk. They were trying to arrange that, and I had sent that information out in my daily emails. The other thing is, I think the CVSs are still, most of the pharmacies or sites, you know, and I like the idea of driving, driving them over and you know, holding them, not holding hostage, but, driving them over and helping them to get the vaccine. Some of the larger agencies have been able to do things like, if you get a vaccine, we're going to put your name in a hat and you're going to win a prize, which always, money talks, and that's always helpful if you can afford to do that. But right now, I think with the large vaccine, most of the vaccination centers are starting to close. I don't know if you
Right.
know that. And I
Right.
literally just read now that Governor Hogan is ending the state of emergency
He
July
has.
1st.
Yep.
So that means that probably a lot of those other large resource centers are going to close. And I think you're going to be much more dependent on, on the pharmacies or the health departments. I think the local health departments trying to call and speak to them might be, beneficial, depending on what county you're in. Some of them are easier to access than others. I know the smaller counties, were much easier. I know Howard County was one of them that was ahead of the curve for, for a lot of this. So I'll see what I can find out that I don't, that I haven't already uncovered. But I think at this point, the pharmacies are going to be the best bet. So however you can get your folks there is probably going to be the best. But I'll look a little bit more into the health departments too.
Yeah, it would be great if they would, do a little pop-up clinic someplace that was central for your employee base.
Maybe you could get those Hopkins and those hospital vaccination
Well,
vans.
that's what I'm thinking, if they're going to move toward this more targeted intervention, it makes lots of sense to go. And who would not want the primary home care employees vaccinated, as much as possible?
Well, it is 5:13, and I know that Carmel, I promised her that she would be able to walk away at 5:10 so as to be in her car by 5:15 in order to get to her next obligation.
Yeah.
So we all take a moment and thank Carmel. The cool thing about Zoom is that you can do all of these like fun reactions.
Oh yeah, this is fun. Here, I'll give you some reactions too. Here, this is what I have to say for you.
Carmel, your presentation was phenomenal, and your real world, tangible, practical feedback was fantastic. And so we are thrilled that you were able to join us again. And I suspect that I speak for everybody that
I really enjoyed it. And, may the force be with all of you. We've come this far. We can do it. Take care. Thanks, Charlene.
Thanks, Carmel. So thank you for joining us today, and we hope you'll join us tomorrow. But now we're going to jump right ahead to talking about building vaccine confidence through trusted messengers using vaccine champions and Houseworks. And Houseworks is a private duty. It's actually a huge independent private duty home care agency based in Massachusetts. They hire caregivers just like all of you to work with seniors in their homes and in facilities. And they were able to achieve, at last count, more than 70% COVID vaccination coverage. I think it might be higher by now. Joining us today to talk about Houseworks is Andrea Cohen. She's the founder and vice chair of Houseworks and has rapidly become one of my favorite people. She is an incredible healthcare executive and social entrepreneur and visionary, and she is literally dedicated her time and her career to transforming how care is delivered to seniors at home. So she founded Houseworks more than 20 years ago, I think 25 years ago, and really took an entrepreneurial approach to growth. And that's how they built this, one of the largest agencies in the in the country. But beyond that, Andrea's individual accomplishments are numerous. She helped to conceptualize sports center rounds for the home care industry. She was involved with she played a strategic role in the launch of the National Village Movement, partnering with Beacon Hill Village and the VTV network. She was part of starting more than a dozen villages nationwide. She's been a formal advisor to a number of companies like Care.com and Rendever, but she's also been an informal advisor to a number of companies like mine. She has been widely recognized for her expertise through awards from her alma mater, from the Greater Boston Chamber of Commerce. She's on the board of the Home Care Association of America and on the board of the Caregiver Action Network. I am thrilled that Andrea has joined us today and is willing to share with us a little bit about her journey addressing vaccine hesitancy and houseworks. And so the nature of our interaction today will be a dialogue. So I'm going to stop sharing, and we're going to have Andrea is in the audience. I can see her there. And we're going to have a back and forth discussion, and that will be how we, the story will unfold about how Houseworks took on this challenge. And so I want to start by just welcoming you, Andrea, to our talk today.
Thank you. I also want to say that many, many years ago, we had an office in Washington and Maryland, and we had joined MITCA, and really just, I just was really impressed with the organization, and thank you for having me, and thank you for hosting. And a lot of the villages that I helped to start out were actually in the Washington, Virginia, Maryland area. So I just spent a lot of time down there, and I have very fond memories of all the people that I met and all of the people who are running home care companies. It was just so I'm really happy to be here. So thank you.
We're really happy to have you here, and yes, we are a collective fan group for MINCA. So
yeah, really a great organization. So I don't know how you wanted to. I was just going to tell you a little bit more about Houseworks, and then sort of just slide into it. As Charlene said, that we've been in business for over 20 years. I founded the company. And for those of you who have been in business for longer than 10 or 15 years, you remember that back then there were no recruitment issues, no retention issues. I mean, it was just, there were a lot of other issues, but those weren't the issues. But even back then, as a new company, we were one of the first independent companies to spring up in the country. And right now, our biggest sort of market is in Boston, but we have smaller offices in Philadelphia and in New Hampshire and Southern Maine, and we are continuing to grow. I'd say we have about 300-ish caregivers in Boston and about 100 in each additional site that we're in. But about 13,000 hours a week in Boston, and our average. We've had people that have been with us since the company started for 20 years ago, but our average rate is about a little over 4 years that people stay with us. So we have a pretty good retention rate. We've got a lot of people that have stayed with us between 5 and 15 years. And I say that because one of the things that I just wanted to say right off the bat was we are talking about vaccine hesitancy here, but I think it's really important to understand that when I saw vaccine hesitancy, and I ran, with Charlene, the sort of vaccine hesitancy for the company, I took on most of what it took because I realized how important it was. When I look at it now and I think about all the time and energy we spend, and we're still spending on it, I really see it as, everybody's getting on webinars to talk about caregiver engagement and retention. And, vaccine hesitancy, if you do it right, can really support any efforts you're doing on retention and on engagement when you hear more about our model. The other thing that I wanted to mention about Houseworks before we go any further is that we also do a lot of work in senior housing. It was over 50% of our work is in senior housing. So with vaccines that, I don't know how many of you actually spend a lot of time in senior housing. And so you know, it was when it came to testing and vaccine hesitancy, the senior housing sometimes was a different animal than in terms of what they required around vaccines and around testing than sort of if you were dealing with families in the community. So about 50% of our people do live in senior housing in Boston. So I want to make sure I told you that. So, you know, there's not even a chronology, but it's, you know, by the time the vaccine came around, we were almost a year into just the pandemic. And for all of you who were running home care companies during the pandemic, you knew that sort of things were coming at you fast and furious. You didn't know what the next day was going to bring. It was just, you know, slightly reactive as much as you try to have a plan. And, you know, I think for a lot of us, because we're really not through it yet, because we're dealing with all this vaccination, we're dealing with all the variants now, we're dealing with still anxious family members. You know, I don't think we've realized what an impact it's had on us or our caregivers, and we haven't really breathed through that yet. So I appreciate that, and I appreciate all of you who are still doing all that work to sort of keep us going. But, you know, so but while we were dealing with the pandemic, we were, you know, there was, as you know, for us, and I don't know how it works in Maryland, but for us, we had to decide whether or not we were actually going to see COVID positive patients. And, you know, that was a big decision. I was clear with my team that I wanted to, so that, you know, that was a whole nother layer of work that we had to do. And in order to do that, you know, you really have to sort of start. We always felt like we were a company that tried to build trust with our caregivers, but like the pandemic, it was just like, you really had to figure out, you just really had to think all the time about what it felt like to build trust and how to do that and what's the best way to do that. And for us, part of what we had done before the pandemic, although it sort of switched a little bit, was we put into place a layer of what we call a caregiver engagement specialist, because we realized that, you know, we have schedulers, we have case managers, we don't have nurses, but a lot of you have nurses because by regulation. But there was always this, you know, who does the caregiver report to? Who's the first person the caregiver reaches out to? You know, all of that. So for lots of reasons that I'm not going to get into now, we put together what we call this layer of caregiver engagement specialists. And when we keep going on and talking about the vaccine champions, the caregiver engagement specialists were really the people that we look to help us with vaccine hesitancy. But in terms of what they really did, you know, I can give you the jargon for it, but really, you know, they were there to, you know, and all of you have this onboarding process, and, you know, like we wanted one consistent person or people there that the caregivers could trust and rely on and ask questions, and we're there for them all the time. And that's what these folks did. They were also, you know, if something went wrong on a case, the caregiver engagement specialist went out and would meet with the caregiver and talk with the family a little bit at a little bit different level than the case manager in our mind would do. It was just at the level of caregiver to caregiver, peer-to-peer support. So there was lots of things that the caregiver engagement specialist did. And part of it was even just advising the schedulers on who to put on a case, because they know them better than anybody, because we were a pretty big company in Boston. And in the beginning, when I founded the company and we were smaller, we sort of knew every caregiver. So when you don't know every caregiver, it almost forces you to put this layer in place. You guys might have different ways to keep track and monitor and know your caregiver. So when you're doing the match, you can match them better. But for us, you know, we felt like we were losing track of that, and we wanted to do that better. So these caregiver engagement specialists really helped us do that. And they're like, you know, they sort of bridge the gap between the caregivers and the office. We found that they were really the first person that the caregivers reached out to after their orientation. And then the caregiver engagement specialists sort of report into us and sort of tell us what's going on. And the other thing that we've been told is that these caregiver engagement specialists, like, they would get these caregivers to sort of open up and tell us what's going on in their life. So, you know, we would understand sort of the emotion of what's going on in their life. And if something happened on a case where they didn't show up, we would have a better understanding of why it happened. And that was really important to us. So if you think about what we did before the pandemic, and we took that model, like, and we saw these folks, and, you know, and then, you know, the whole idea, the vaccine started coming out and the clients started calling us. It's like, and, you know, probably like many of you, there are, you know, a small subset of caregivers who just immediately went and got the vaccine. Some of them, it was easier for, because if they were reporting into cases in senior housing, the senior housing people had the vaccine right there. You know, it wasn't so easy. We created relationships with hospitals like Boston Medical Center, which is a Boston hospital for underserved, vulnerable populations. We had a really nice relationship with them where we could actually call and make appointments for vaccines for caregivers, and that really helped us at first. So, you know, and so we had, you know, the small, and then the undecided, which was, you know, probably 70% of the folks that, and then those who just said absolutely not. So, so it wasn't easy to get this done. And it's like, okay, we have to have a response. We have to figure it out. And, you know, how should we do this? And you don't really, there's, you know, it was sort of like, felt like when I started the business 25 years ago, there were absolutely no benchmarks. There was no other companies like ours. Like, you didn't know really what to do. You just did it. So we sort of spent a lot of time just on the fly figuring it out. And then I got introduced to Charlene, and that was a godsend in the sense of just having another person who actually knew more about the vaccine and the science behind it, plus knew about caregivers and public health. So that was a big help to us, to find an expert that can help you, you know, whether it be someone that's maybe on your team, if any of you have medical officers, or, you know, anybody. But that helped me because I was in uncharted territory, which I'm used to being in. But, you know, in a pandemic and what we're dealing with in life and death and the whole industry, you know, everybody calls private home care non-medical. We're very medical, in fact, and we do a lot of work, you know, right through hospice and when people die. But like, it did really change the stakes a little bit. The whole, everything that we had to do became a little bit harder for us. I'm going to stop there, Charlene, see if you had a question. I can just keep going on, but I want to make sure I'm directing it in the way you want me to.
No, you're doing fabulous. I was going to ask you questions that took us through the chronology, but you're actually already doing that. So just continue.
Okay, perfect. Then I'll just keep, and then at the end, we're going to have questions and answers, right? Because I want to be able to answer people's specific questions if they have them. So, you know, so in terms of our response, you know, my feeling is that how do you get these folks who are sort of in between? What's the root cause of why folks are hesitant? And, you know, and that's again where Charlene helped, but I also started talking to our caregiver engagement specialists, and the root cause was much about they just didn't have the right information, or they're getting third-hand information, they were listening to other people, there wasn't anybody sort of telling them. They didn't know how to, they'd never done something like this before, where they had to research something, or they had preconceived notions about the vaccine. Everybody knows sort of the major factors of why people were hesitant. It happens by, you know, there's consistency, and then there's, you know, and there's this one-on-one. I mean, you gotta like customize it in a sense. And so, and we were lucky enough to be able to do that because we had these caregiver engagement specialists kind of teed up to do it. So I started talking to them, and then we also had to figure out, I mean, you know, they were doing other things. So then vaccine hesitancy became a lot of what they did while we were really at the point when the vaccine became accessible. And, you know, from a business perspective, you got to think long and hard about what they're not doing in order to do vaccine hesitancy. And there was definitely talk from our senior team about, is this what we want them to be doing and how long can this happen? And that's just a sidebar, but I didn't want to just not say that because that was something that came up. But so we realized that the best way to do this is to figure out a way to do this. So we were also testing, and we did testing in a lot of different ways. At the end of the day, we started doing weekly mandatory testing. That's a whole nother topic that I'm not going to get into now because that would take up way too much time. You know, like, why are you doing that? We went from bordering on no testing to weekly mandatory testing. But basically what that allowed us to do, these weekly mandatory tests, is to have a touch point. So the vaccine hesitant, so we took 2 of our caregiver engagement specialists. We had 4 at the time. And 2 of them hadn't been vaccinated, and they refused to get vaccinated. But by the time we were done through this process, they both became vaccinated. So that tells you something. So part of our touch point was, you know, meet them at the testing site and hand them information and talk to them, and talk to these caregivers about, you know, the vaccine. And so I think, and the other thing that we did that I thought was really helpful was, again, using Charlene. We, you know, as a doctor, she actually, you know, it was kind of a train the trainer model. So Charlene got on the phone with mostly the 2 caregiver engagement specialists, you know, who became the champions. And oh, by the way, we started thinking about, you know, using social media to sort of let everybody, the caregivers know, get on their Facebook page. You know, and I don't think that was bad to do, but I don't think that was the end all and be all. I think you have to think of things as, what's the intervention that you really are going to rely on? And then what are the ancillary things that you can do to just raise awareness? And I think that's where it was like, okay, we're going to raise awareness, but what's the intervention? And I think when you guys have thought about what you do, you might want to bucket it in sort of in that way. So, you know, Charlene got on the phone, and you would remember the details, but it was like once or twice a week for many weeks to just teach people. You know, we did a survey. It's like, help us understand why, you know, what your questions are. And then basically did a train the trainer of these vaccine specialists so they could answer the caregivers' questions. And the other thing that I think is really important, and, you know, again, you might know all of this, but maybe it's confirming, or maybe you think you thought about it, but you didn't actually do something about it. But what was also really important was that anybody who was involved in this process, from the CEO down to anybody, is that there's no judgment. There is not a question that's silly. If people, like, you know, you always think about that term, perception is reality. So if people think that XYZ with the vaccine, then that's their thoughts. And we have to really help them understand, you know, not convince them one way or the other, but help them understand what the facts are. And then, you know, once they understand the facts, maybe talk it through with them. Our caregiver engagement specialist told us that it wasn't one call. The interventions were calls from the caregiver. Either they met them at the testing center, or they would call them up, or they would actually be seeing them in the field. It took between 1 and 8 times for the hesitant ones to get from hesitant to get the vaccine. So think about that. That was a lot. And basically what Vinette, who is one of the people you're going to meet tomorrow, she told us, you know, she wouldn't get on the phone and say, let's talk about the vaccine. She would get on the phone and say, how are you doing? How are your kids? What's going on? How are your cases? How are the clients? And then it might, you know, have you thought more about the vaccine? So you have to go through a conversation. You can't just get right into it. You have to kind of meet them where they are, because if they're hesitant, that's not, you know, again, it's continuing to build trust. So, you know, after, and this was really helpful because, you know, afterwards, I didn't really exactly know what the interventions were. I didn't know it took 8 times. It was just kind of happening. But afterwards, I found out how it happened. So I'm hoping that some of what we learned can be helpful to all of you as you sort of think through, is there one small thing that I can do? Is there something that I can add to it? I just, right before I got on this webinar, I got an email from a friend of mine who runs a home care company in New York, and he said 38%, I think he was using of vaccinated caregivers. He's like, I don't know if this is a Northeast problem, how are you guys doing, where there's a group of us that all have large home care companies across the country. And we've been sort of talking about this, but, and the other thing that is interesting to me, I don't know how many of you, well, some of you might be straddling at least 3 states, but, our New Hampshire office, the caregivers up there are much less willing to get vaccinated, and our Pennsylvania office, which is in Philadelphia, they're much less willing to get vaccinated than Boston. I'm not sure, again, if we're doing it as well down there, or if it's regional, honestly. So and I'm going to try to pick at that a little bit, but I just sort of found that out when I was thinking about it. Right now, one of the things that Charlene had asked me when we were preparing for this was, we are not requiring people to get vaccines. I really don't want to do that unless I just don't want to do that. Now, for them to go into some senior housing, they are required. Like, so there are folks that are required because they're in senior housing, and either they have to get the vaccine, or we'd have to put a different caregiver in there, because that's just part of what they require from us. But we're not requiring people to get the vaccine, and we're not hiring people who are only vaccinated. That was another question. So we are hiring people who are not vaccinated, but in the onboarding process, we are talking to them about getting a vaccination, and are they willing to think about it? And, because then we would know better. We also, when in terms of the vaccination process, we do keep a record of it in, just to know whether they're vaccinated or not, because we are getting a lot of clients, and I'm assuming everybody is, that just want a vaccinated caregiver in their house. And because some of you might not be private pay, we're all private pay, and not no Medicaid, even no Medicaid private, just private pay and long-term care insurance. So it's either out of pocket or long-term care insurance. So, if a client says that they only want a vaccinated caregiver, they're paying for it. So we have to figure that out for them. We do try to tell them, we have talking points for them to tell them that, PPE, it's safe. We have all of our talking points, or we might be able to say, we can't find a vaccinated caregiver, and here's who we can send, and we can assure you that they will be wearing it, and they get tested, and et cetera, et cetera. But the customer does have the choice to be able to choose that. One of the things I also wanted to mention was, and I did, because we have nurses in New Hampshire. We do not have a nurse in Boston. We have a nurse in Philly. I of course at first thought the nurse would be the person that the caregivers could turn to, and that's actually not true. So, like, I think a lot of companies thought in the beginning that okay, well, I'll assign the nurse to this project of vaccine hesitancy, and sometimes the nurse isn't the right person. So that was just one of the assumptions that I made that turned out not to be true. And sometimes it's the scheduler, sometimes it's, and it's also just like, you also have to think about time, because I don't know about for you, but for us, running a home care company and getting it all done during a pandemic took a lot of time. And, most of us are pretty lean in terms of the amount of staff that we have. So you also have to make room for this. And that isn't always easy to do. But, so I did want to mention that, we did start making the badges and start, we did do some of that. I just don't know how much of that worked. We talked a little bit about that before. So I think I pretty much covered most of like what I wanted to make sure that I got out there, and now be helpful for you to just go through any questions you might have, Charlene, before we open it up.
Absolutely. Thank you for that great summary of how you approached vaccine hesitancy over the last couple of months. I'd love for you to spend some time talking about the decision, the leadership decision to focus on this. And you said that there was some discussions about, you know, the baseline workload of the caregiver engagement specialists and the decision to enable them to divert some of their time to this. What were they doing at baseline, and how did those conversations evolve?
So, you know, again, I think the whole pandemic, everybody's leadership team, you know, or even if you have, you know, you have one or two other people, then the three of you, I don't know who's on the call in terms of what level you are at the organization, but everybody's, you know, there was this, you know, there was this thing where, like, during the pandemic, like, at first we didn't know how bad it would be, and then it just kept getting worse. And then it's like, do you serve COVID positive patients? And then, you know, so I realized as the CEO of the company that I was going to have to make this a priority, because otherwise it would be like, okay, well, let's get people vaccinated, and, you know, we should track it, and, you know, but if I hadn't done that, people were so sort of strung out on everything else that they had to do. So I feel like in everybody's company, there needed to be one person who just said, who was at a pretty high level. It also, like, shows well that if you get the senior team involved in saying, you know, we really, really, really want to support you on this. I think we got feedback from not only the caregiver engagement specialists, and frankly, that's a really important position to us, and it's really hard to find caregiver engagement specialists. Most of them were caregivers. We sent them to school for management training. It's not that, you know, every caregiver says they want some sort of a career path, but not every one of them is right for every job, and some of them don't even understand what the job may be. So it's just not an easy position to fill. So we wanted to keep them engaged and happy too. I had a conversation, as you know, and I'm talking like as a leader, to Vinette, and I said, you know, and I said to her, boy, this is a really cool time in the company, because you can do this much better than I can do this. You know, you as the caregiver engagement specialist can lead these caregivers and this project way more effectively than I can. And, you know, she probably knew that anyway, but to hear me say it, because she's like pretty savvy, you know, that's what I love about her. She probably knew that anyway, but like the fact that I acknowledged that she would be better at it than I would, I think went a long way. So I think as a leader, you're looking for how do you sort of garner that support from your senior team, or how do you get your senior team to come out and talk about it? And then at each layer of the organization, you have to figure out how to sort of disseminate it. But you also have to make sure that everybody in the company is behind you on this, you know? And as I said, when I started the conversation, I feel like us as a company has sort of, you know, showing as much attention as we did to this problem, I hope made the caregivers who were going out there in the field when we were sitting in our houses, you know, for the most part, for those 3 really difficult months last year, that, you know, like, I hope it showed them that, you know, we're trying to create a safe space for them. And I think that's really important, that we create, you know, we as people running the company, however you can interpret that in your own companies and however you want to talk about it. You know, again, Charlene and I, we talked about having a town hall and getting people together, and then, you know, we didn't do that either, really, because how are you going to get these people together? You know, we're going to do it 4 different times for 4 different shifts. Most of them probably wouldn't have wanted to do it. So, you know, the other thing that we did was we turned it around to make it their time, like make it convenient for them. we would have done anything to make it convenient for them to do the vaccine hesitancy piece of it, which frankly, I again say in terms of retention and engagement of caregivers in general, as home care operators, we have to learn how to make it, on the caregiver's terms, because that's how hard it is to get people. And, as an advocate of home care, of professional caregivers for the past 20 years, as hard as that can be in some ways, yahoo. I mean, it's about time that, if the pandemic did anything, it helped us professionalize caregiving and help people understand how important it is for us to do that. And I feel really good about that as an advocate for caregivers and just professional caregivers that have chosen this. So I think, as a leader, you just have to, people have to understand that there's passion, and maybe if your leader isn't so passionate about it, there's someone in the organization who's just out there talking about it. And so there were some hard conversations, and with different people who didn't really want to deal with doing the extra work, and if that was the case, this was a non-starter, we had to do it, you know what I mean? And so and for most of the people on my team and in my company, people were really, supportive of wanting to be part of this process and helping it. But, in any organization, there's always one or two people. And, and then it just, it became one of those things that they just knew they had to do. So.
That's great. I'll ask you to talk a little bit about compensation and whether or not you compensated the caregivers and what that decision tree was like.
Yeah, I mean, we did compensate. We did compensate the caregiver engagement specialists to do the vaccine hesitancy work. We gave them a bonus for it. It was also sort of, the timing was good because they were due for raises anyway, so they got a raise and a little bit more. We elevated one from a caregiver engagement specialist to the director of caregiver engagement, and that was, again, a big help, because it also helped everybody in the company to realize what an important position that is. It's not just like another layer in between the caregivers and the administrative team. They are so enormously helpful to the organization. Again, for those, I don't know how all of you are structured, but we all know that the schedulers are like the people who are the heartbeat of the organization, and in our organization now it's sort of both. And I think the pandemic helped that. So yes, we did compensate them and try to give them, to try to acknowledge with some level of compensation about how important it was, because they were working. The caregivers, we have an on-call system, but the caregivers were calling them. What should I do? Okay, Vinette, I'm ready to do it. Let's go. And they sometimes the caregiver engagement social would actually escort them to the vaccination site if they were nervous. I mean, in senior housing that was easy because it was generally on site, but they would do that anyway. And that was just like, what a wonderful way to help somebody. So, yes.
Thank you, Andrea. Now I'm going to spend like 2 or 3 minutes and summarize the intervention that Andrea described, and then we're going to open it to questions, and we can go as long as you want with the questions. So I'm going to share my screen again. Okay. So the first thing that Andrea mentioned was the importance of selecting trusted messengers, right? So the caregiver engagement specialists were the trusted messengers, but the reality is they were the cohort, they were the group, the individuals that the caregivers at the agency already trusted. So in terms of building trust, there had already been a lot of work done before the vaccine hesitancy work, so that group was already trusted. And as Andrea mentioned, they were already getting inquiries, and other caregivers were turning to them to seek advice about what to do about the vaccine. So they were the right messengers. But that role of the trusted messenger can be anyone. It might be, you might choose a peer-to-peer approach, you might choose your schedulers, you might be an administrator, you might be the administrative assistant. It's the trust is more important than the title, and the trust is more important than the knowledge, because you can teach anyone about the vaccine, and you can teach anyone how to address the myths and the concerns about the vaccination. And that was one of the things that we did. We really focused in on translating science to the simplest, most basic level, so that the caregiver engagement specialists actually became viewed as experts within the agency on the vaccine, and they actually were. Other steps involved in understanding the caregiver's concerns. So that's what Andrea talked about, but we actually did a deep dive interview with the caregiver engagement specialist to review all of the different topics that caregivers were asking about. And we used that to shape how we did the capacity building in step 3. So we understood what they were concerned about, and then we taught Vinette and Marcia how to address those concerns, like how to address it. So they were already trusted, so that when they were able to address the concerns, people believed them. Then the next step was actually doing the outreach. So we didn't just wait for people to reach out to Vinette and Marcia. They literally went through a list and like sat by the phone and made call after call after call. And as Andrea mentioned, sometimes that was multiple calls over time. So if somebody was adamantly against the vaccine, maybe you waited a couple of weeks before calling them. If somebody was hesitant but wanted more information, you know, was like, I didn't really want to do it, but let me ask you 5 questions. That's somebody that you can follow up within a week or 2. So it ranged, the number of times that they had to be contacted ranged, but it was one time for a minority of caregivers that were already hesitant. The 5th step was once you actually moved somebody from hesitant to, you know, ready, then this is much less true now, but at that time there were a lot of constraints to actually getting the vaccine. So the vaccine champions actually helped to make appointments. They physically went with people to their appointments. They helped to remove constraints. Once somebody had made the mental shift from hesitant to ready to get vaccinated, they helped to make sure that that would happen. And then finally, there was the compensation step that Andrea mentioned. So those, to kind of consolidate everything that Andrea described, that was how you could break down the intervention into these 6 steps. We had talking points for the vaccine specialists, and I wanted to point you towards the COVID caregiver fact sheets that we developed for Minka. So you yourself actually have fact sheets through Minka if you choose to use them. They're online, they're available. Sarah, who's with Nonprofit Resources, who's in the back doing all the tech support, will drop those links in the chat for you. And we're also going to send out an email with resources at the end of the week. So on that note, we are going to shift gears and open the floor. Do you have questions for Andrea? If so, we're a small enough group that you can actually just unmute and maybe take off, you know, turn on your video and like just raise your hand. If you're shy, then you can let us know by raising your hand or dropping a note in the chat.
I looked at all of the chat, and a number of people had gotten to a certain point of, you know, 70%, and then I want some creative ways to get more. And I would imagine that there's probably a lot of people are doing that. So, you know, I don't know, Charlene, do we have any words of wisdom around, you know, that last 30%? I mean, we're still just, I actually think I'd love to hear people's feedback on that, because I sort of, you know, or what have you done? You know, it's like anything in home care. There's not one magic bullet that's going to help you, you know, get caregivers. There's not one, there's not ever one magic bullet. I think that, you know, like maybe the best way to just, like, I think part of it's in the framing where you say, so for July, I'm going to do this, for August, I'm going to do this, you know, maybe it's take it month by month and sort of, and then watch it creep up. And, you know, I think that could be some of it, you know, and Charlene and I have had a lot of conversations about, you know, saying you're not going to be able to work for the company anymore if you don't get vaccinated, or trying to say, well, everybody's asking for a vaccinated caregiver, so you better get vaccinated. Like we're trying our best not to be punitive about it. And my vision would never to be punitive about it, you know, but I think, you know, there's ways that you you know, maybe every month you come up with something where we're at 70% now, let's get to 72%. Maybe it's a contest. You know, some companies have talked about, you know, compensating people to get vaccinated, which we have stayed away from, but maybe you can put, you know, you can put a, make it a contest, or, you know, do something around it, and with a month by month goal to be able to get to a certain point, and everybody wins something at the end, or you do a company picnic at the end if you can get to, you know, I don't know, but I'd love to hear, I'd love to hear if anybody has any ideas, but I've been trying to think about it too, because it's always those, you know, like when you're trying to lose weight, it's those last 10 pounds, right? I feel like it's just like, this is the last, and you just really just want it to happen. But you have to keep, you know, the one you know, the takeaway that you've heard over and over again is about consistency. So it has to, you have to be consistent at it. So that's why I personally like a month-to-month plan.
Well, thank you, Andrea. Nicole Savoy has a question for you. So just go ahead and unmute yourself, and feel comfortable showing us your face. That's great. If not, we'll be able to hear you.
She might be having a bad day and doesn't want to show us her face. I'll probably stop my video because I think my picture's better than my face.
Okay, Nicole, the floor is yours.
Well, good afternoon, and thank you just for having this. I was just, I had a short meeting with my supervisor just before this meeting, and we were talking about the different reasons why people were experiencing hesitancy, and our agency works with individuals with disabilities. So a lot of the community that we serve have caregiver support. And so we're just, you know, trying to strategize a way to either encourage the individuals to talk to their caregivers, or, you know, find ways that we can reach those caregivers that support the people that we support. And we were just wondering, you know, different ways on how to reach those caregivers. I was in another webinar hosted by Georgia Tech, and a lot of the presenters themselves even said that they had some vaccine hesitancy, and we were trying to see, you know, if there were certain pockets or core reasons that a group of people that could like get around why they were experiencing hesitancy. So have either of you identified like core reasons and have done outreach to address those reasons? Like, for example, some of the presenters at the Georgia Tech webinar were explaining that there was some cultural hesitancy, especially in people of color. And I know it's at least in the Maryland, DC area, quite a few home caregivers are people of color. So have either of you experienced that, some of the cultural, historical backgrounds for vaccine hesitancy, and has there been any outreach to talk on those points specifically?
Yeah, Charlene, do you want to? I think you should take that one, because you really poked and prodded it up for us. But yeah, a lot, in fact. And I think, do you want to start and I can finish?
Absolutely. So Nicole, thanks for asking that question. You're correct. In the Maryland, in the DMV, so DC, Maryland, Virginia area, the majority of caregivers in most parts of Maryland are actually Black, either African-American or of African, part of the African diaspora. Similarly, in Massachusetts, I know that Houseworks has a lot of Haitian and Ugandan caregivers. And so there definitely were concerns about the vaccine that had to do with concerns about about exploitation, racial exploitation. So when we did the deep dive into looking at some of the reasons for hesitancy, there were concerns about depopulation, so that the vaccine was part of an effort to depopulate Black people. There were concerns that at the vaccine sites, there was an organized effort to make sure that Black people got the real vaccine and that white people were getting the placebo, so they would be safe. It was all part of a big ruse to give this toxic substance to Black people, to remove Black people from the earth. There were concerns about this new world order where there's these influential people are coming together, again, as part of this depopulation strategy. And so, when you take a step back from all of these concerns, believe it or not, they make a ton of sense, right? Like there's, if you think about, so I spent 9 years of my career in global health. And so I worked for the US Agency for International Development, traveling around the world. And for decades, US governments, other governments have spent billions of dollars on reproductive health interventions in low and middle income countries around the world. Many of them were making Depo-Provera available to women to prevent pregnancy, right? And so Depo-Provera is an injection. There's an organized effort to give women an injection to make sure they did not populate the earth. And if you ask Mike, I'm also from an immigrant family, and if you ask my uncle today, he still thinks USAID was trying to keep Black people from having babies when they came with their injections in the 70s. And so, like, it might sound ridiculous, like, depopulate the earth, what are you talking about? But actually, when you think about the number of African immigrants in the caregiver workforce, and you look at the history of the things that we've done, it's not, a lot of people like to point to Tuskegee, but it wasn't that long ago that we were doing some pretty sketchy AIDS research and when I say not that long ago, I mean like in this century, in parts of, I think, Tanzania. Like we have such a history of, like we have such a history of questionable interventions that when we come along with something that is not questionable, it makes sense that people question it. So what we did with the caregiver engagement specialists who were serving as vaccine champions, we actually literally, so the talking points, maybe I'll share my screen to show them. The talking points literally go through these types of questions. Like, is this an effort to depopulate the earth? Are they experimenting on me? Will this mess up my DNA? Lots of questions about pregnancy, Bill Gates. We heard that influential people created the vaccine to control us and begin a new world order. So we have this fact sheet, but we didn't just hand out fact sheets to caregivers. What we did was I spent time with the caregiver engagement specialists, and we talked about why people were worried. We gave them the tools to have real conversations that were based in respect for the ideas. Even though the ideas were wrong, there was no judgment. And so by taking people who are trusted and then creating space for people to share their concerns, even if you and I may perceive them as outlandish, they're not actually outlandish, they're rational in the context that they're coming from. And so we addressed them head on. We didn't sort of have like a big talk on like all the reasons why the vaccine is good. It was a customized, individualized approach. The vaccine champions didn't go out and say, why don't you want the vaccine? Why don't you want the vaccine? People told them. They were already trusted. So people were coming to them anyway and saying, I think this is, the depopulation thing was very popular. And so they were able to talk coherently about both the, like, why that wasn't true, but not just by saying it's not true. Like, it's not true. Like, that's not convincing, right? They were able to contextualize why one might think it is true and why in this case it's not true. So tackling the concerns head on, but in as much as possible, a tailored way is how you'll get the attention of people. When you address their specific concerns, then you actually have the power to influence. I mean, when I worked with the vaccine champions, we even talked about the stages of behavior change and how when someone's pre-contemplative, it still has impact to share a new idea, but that you actually like take a different approach to how you communicate based on the stage of readiness the person you're talking to has around the behavior change, the health behavior change we're trying to inspire. And so I hope that answers your questions. The answer is yes, but we didn't do it as like a big talk. And all the reasons Black people have crazy ideas about the vaccine, it was much more individualized and validated through respect, and then invalidated through data.
Yeah, and like if you take, and I totally agree with you, Charlene, and if you take all of that and you say, okay, so now how do I do that? You know, it could be like if you're sitting down with someone who's hesitant, you know, because I was trying to visualize what that conversation would look like, regardless of who does it, we know you have to trust them. And then, you know, so tell me why, you know, tell me what's up, what is it? And then they tell you, or you could start with, well, here's what I'm hearing that people are thinking. And if some of that's what you're thinking, then they'll know you're clued into it, right? Like, so it might be even good for you to get that fact sheet and then sort of open the conversation with, what's up? You know, this is what I'm hearing. Tell me, you know, is this what you're thinking? And let's talk about it. So I would use that fact sheet as a place to have the conversation so you could get a better sense. And, you know, when I heard all of what Charlene was telling us, you know, it all came down, we talked about, you know, the lack of trust. Vinette was saying that a lot of the folks that the caregivers that she was talking to, they get a lot of their information off of social media, you know, and they didn't necessarily validate the information. So that, you know, like, so it's important for you to also understand they're getting their information mainly off of social media or from friends that aren't, you know, they're not going to be talking necessarily to people that are believers. They're going to be probably talking to people that aren't believers. And that's why they're still not a believer, because they're only hearing one talk track. And, you know, they think it's going to hurt them more than it's going to help them. So, you know, maybe you can say that, and there's lots of stuff out there about that. Like, it's, you know, I understand that you think, but let me tell you how it's going to help them. Like, take it and just, you know, go with it as much as you can and do it in small groups. So.
Thanks for that question, though, Nicole, and thanks, Andrea, for adding that answer.
Thank you very much.
Sure. Other thoughts, concerns, success stories, or challenges that you'd like to share and get feedback not only from us but from your peers. This is a chance to talk to an audience that cares very much about the same things that you do.
Hi, my name's Ardella with Premier Home Care in Maryland. We have a lot of, our numbers are starting to come in. We've been asking repetitively, hey, send your card, you know, and as Andrea says, you know, all those blasts, you know, it's like they fall on deaf ears, you know, if you catch them in the title subject line, maybe, but, you know, what we've done, we've taken the remaining ones that we do not have a card, and we just divided it up, you know, between our staff. You know, Premier's internal staff is pretty small. And we just did, I call it dialing for dollars, you know, reaching out, you know, trying to make that contact, you know. And again, as Andrea says, you can leave them voicemail messages. Do they really call you back? No, you know, and stuff. So it's hard to get a hold of them. But, you know, we started that at the beginning of the week. And just by getting cards back, we've gone from 70% to 75%. And I still have 3 staff members that need to get numbers back to me. So I'm hoping that we actually might hit 80%, and then we have to tackle the no's, you know, why. I do see that caregivers that are pregnant are a hard no. You know, they are not going to be having it during, you know, pregnancy, which, you know, hey, I can understand, because even though there's no real science that says differently, a lot of times things like that don't manifest for years down the road. So, you know, you can't push back on that too hard. But, you know, Charlene, if you've got any comments in regards to that, I think fertility and being pregnant is a big drawback.
Well, the good news is that there's not only evidence that it's not likely to harm your your baby, but there's actually evidence that it's likely to help.
What is it,
and-
vitamins?
No, it's antibodies, right? Like there's
Oh, right.
might actually offer a protective effect to your infant. Like it's actually everything that's come in so far is extremely, it's not just like, oh, it doesn't hurt you. It's more like, whoo, it helps you so much. I can, Ardella, if you email me, I don't know, were you on the email chain I sent out earlier? Oh, you're on mute. Regardless, I'll put my email in the chat, or just contact Minka and you'll be able to get in touch with me.
Yeah, Dawn has my email, but I'll send it to Dawn and just ask her to push it down to you.
Yeah, I'm happy to share a couple of resources.
That'd be awesome.
Help, but also there's a lot of more recent information that's very promising. And so I actually, the two specialists that Andrea mentioned that were not willing to get vaccinated at the beginning, their reasons were concerns about fertility. And one thing that was compelling, this was months ago, was that there were thousands and thousands of women in the trial, and you weren't in the initial trials, you weren't allowed to be pregnant at the time you enrolled, but that doesn't keep people from getting pregnant. So they're like, even in 2020, there were all these babies born to women who have been vaccinated in the clinical trials because they happened to get pregnant.
Okay.
During the clinical trials. And then subsequent to that, as of a couple months ago, there were like tens of thousands of pregnancies being tracked by CDC. Like there's a lot of positive information out there about pregnancy and fertility. If I were pregnant, I would race to get the vaccine because of the benefits as opposed to fears about the harm.
Right. But you know, it just, as someone had mentioned, I don't know if it was Andrea or something, but you know, in the DMV area, you know, our caregivers are, you know, of color, you know, hands down 95% probably, and a lot. Then you have a lot of them that, you know, people weren't born here, and so, you know, what they've experienced in their country, you know, how vaccines were rolled out, et cetera, you know, that also makes them hesitant. So you couple everything, and then all that crazy stuff they read on the internet or in chat groups, you're just like, oh my gosh, you know.
Well, who do they trust? So the key would be
Yep.
figuring out who they trust, right? So I spoke to someone at one agency who said that there were six caregivers at her agency that all went to the same church. And at that church, the pastor was saying that men should be vaccinated, but the vaccine wasn't meant for women. So all six caregivers were not willing to be vaccinated because their trusted messenger, their pastor, had told them not to.
Right.
So you find someone else it's hard to unearth the impact of someone who's trusted, who's giving false information, without having someone who's trusted giving correct information. So I would dig deep and figure out not just it sounds like you guys are working really hard and doing the phone outreach, which is amazing. I would file through your team and figure out who's most trusted, like the most trusted. And then I'd set aside some time for that person to do the outreach to the ones who are worried about pregnancy, and make sure that that person has all of the updated information about pregnancy and the vaccine, so that they'll be ready for any question.
Okay.
They're already trusted. That would be one approach you could try.
Yeah, and I think another one is, well, no one from my ethnicity or my color or have were participated in the trial. Yeah, that's another one. Kickback.
You could check the fact sheets. We actually put some numbers in there, and so
Okay.
yeah, the majority. What was interesting is that the majority of trial participants were white. So all of the initial concerns about how it's this experiment on Black people, it actually was an experiment on white people. And so that it was like, I think 80-90% white participants, but there were definitely, I think, up to 10%. The numbers are available in terms of what percentage of participants were from different backgrounds. And it doesn't really matter who was in the trials because over 1 billion people have gotten the vaccine. So like the biggest trial is the rollout to the world and the 1-point-something billion people that have been vaccinated. I think that also may help. But not everybody's going to be convinced, but I do think there's increasing data that can help. And if you, it sounds like a targeted approach to debunking specific myths might help you get from that 75 to 100.
Yep. Yeah. Okay. Thank you.
You're welcome. Other questions? Other hands up? Anybody else?
Everybody's got the problem solved.
Okay, well, if there are no other questions, I guess I'll invite, wait, is Risa still there? Risa, you put in the chat that you've gotten to 75%. So do you have any tips to share with the audience?
Yes, hi.
Hi, Risa.
Can you hear me?
Yes.
Okay. Yeah, I mean, we just really have been beating the drum on this for months, since January. And we keep kind of refocusing and re-establishing what we're going to do next. So, you know, at first when, you know, this was mentioned before, but it was so hard to just even find an appointment. You know, we concentrated on that, how to get them information about where to get appointments, how to get appointments, telling them not to worry if you can't get one now, they'll open up later. Then as things opened up, we, you know, started saying, okay, you know, now it's easier to get an appointment. When the state-run vaccine clinics started opening up, every time something came up that we thought caregivers would be interested in, we sent that out. So there was a walk-in clinic at the Greenfield metro station here in Maryland. That seemed like a great opportunity for caregivers. So we sent that information out right away. So just like my job was really just keeping on top. Every morning I went online and I looked at what was going on in terms of vaccines and just tried to get that information to caregivers as quickly as possible, so that they always had the right information at their fingertips. And then recently, so we have about 1,300 some caregivers that work with our organization. We've got about 1,000 now who have been vaccinated. So we're just like trying to get to the end. But recently what we've been doing is we have a campaign and we call it, it's easy, it works, it's time. And we're saying like, it's as easy as it's ever been to get a vaccine. You can basically just like walk in anywhere and get one. We tell them how to go, you know, find one online or go to their local pharmacy. We give them information from the CDC about how it works. We have a video also that we made that with other caregivers who already got the vaccine, who are advocating for their fellow caregivers to get it, and some other videos that we found that have been helpful. So just like that education section. And then we say it's time because a lot of the clients and the senior living communities where caregivers are working are starting to require that caregivers be vaccinated in order to work there. We've got some like hard deadlines from senior living communities that say, you know, by July 31st, anyone that enters our doors needs to be vaccinated. And then we also have clients that are just saying, I only want to work with a vaccinated caregiver. So we're letting them know that, and, you know, letting them know that in order to be open to more work opportunities, they're gonna, you know, want to have the vaccination.
That's good.
Thank you, Risa, for sharing all of that context. It's really helpful. What I'm going to do now is I'm going to shift gears and share my screen, and we're going to go through the 5 C's of vaccine hesitancy. And I think it's going to be interesting, given the conversations that we just had, for you to, as we're talking, to think about the types of interventions that you've been trying and where they fit on the spectrum of the 5 C's. So what are these 5 C's of vaccine hesitancy? I mean, I'll skip over the definitions of vaccine hesitancy. We all know that vaccine hesitancy is a continuum, right? Because you have some people who probably were lining up before the vaccine was even available. And then you have people who probably get angry every time you mention the vaccine. But the 5 C's, confidence, complacency, constraints, calculation, and collective responsibility. Let's walk through them very quickly. This was a model proposed by Caroline Betch for explaining hesitancy among parents in the context of childhood vaccination back in 2018, so even before the pandemic. But this model is widely used in vaccine circles and has been applied quite frequently to the COVID vaccination and the hesitancy around it. So the first one is confidence, right? So this question of, does it work? Is it safe? Does the system work? Am I going to get the right vaccine? Like, confidence is almost a precursor to all of the remaining 4 C's. And the types of things that we've talked about, people being worried that it's going to harm their baby, people being worried that that it's all part of a plot to depopulate the earth, like it doesn't work, it's not going to work in me, it's going to hurt me. All of those concerns demonstrate a lack of confidence in the vaccine. So when you hear about people talking about increasing vaccine confidence, it's because you're trying to get to a point where people believe that the vaccine works, believe that the vaccine isn't going to hurt them or is unlikely to hurt them. And most efforts around hesitancy are focused on confidence, building confidence. Lack of confidence. I think Ardella asked about some of the concerns that came up. These are some of the concerns that came up when we interviewed the engagement specialists about what they were hearing from caregivers. And we've talked about many of these during the Q&A. Next is complacency. They're the people who are like, whatever will be, I'm not at risk. Who needs a vaccine? It's not that bad. I know someone who had COVID, they didn't even have any symptoms. I'm not worried. Like that complacent category, those are people who don't see themselves as being at risk of COVID, so why do I need a vaccine, right? Then you have the constraints. Now this, a couple of you, I think Risa, you talked about this. So when you actually have caregivers who are confident, caregivers who've made the switch and they're like, okay, I'm ready, but wait, I can't figure out how to get the vaccine. Removing constraints. So think of the interventions, right? You can build confidence to address the confidence one. For complacency, you can help people to assess their own risk differently. When you're thinking about constraints, people feel overwhelmed by figuring out how to get the vaccine, or they're afraid to go by themselves. These are people that you can help by removing constraints or intervening to help them get an appointment or hold their hand when they're getting vaccinated, providing transportation. During one of the earlier workshops, somebody described literally taking 10 caregivers in her car and driving them to their vaccination appointments. And then there's calculation, right? Like there's this, every individual, all the time, we're weighing the pros and cons. We're trying to figure out, well, I think you described this, Ardella, I want to have a baby. And while I know that COVID is out there and it might hurt me, I think the vaccine might hurt my baby more. And so I'm going to weigh the pros and cons in a way that leads me away from vaccination. Well, this is where you can help people to reevaluate the relative risk of different things. So the risk of COVID during pregnancy is extraordinary. It's terrible. The risk of the vaccine during pregnancy, it actually is helpful. And helping people to reassess and recalculate their risks is another point of potential intervention around vaccine hesitancy. And then finally, this sense of collective responsibility. Now, wouldn't it be great if every caregiver was like, I will get vaccinated to protect my clients? That would be lovely. That's not necessarily going to be the first priority of your caregivers, but they will get vaccinated to protect their family. One of the things that was compelling for some of the people who were hesitant that later decided to get vaccinated was once they kind of started to believe that maybe it wasn't going to limit their fertility, then kind of like everyone knows that the vaccine hurt older adults. Everyone knows that COVID hurt older adults more than other groups. But we went through some of the data, and the mortality data for older adults was so stark that I can think of two caregivers who live with their older adult parents who made the choice to get vaccinated once they kind of understood not just that it was bad for older adults, but just how bad it was for older adults. Regardless, the 5 C's are a model that you can use in whatever way it makes sense for you as you think about how you want to interrupt and intervene so as to increase uptake of the vaccine. I personally love that model. And so you've already talked, a lot of you have shared your ideas about the things you've tried so far. And for that, thank you for trusting us and trusting the group to share some of the things you've tried and things that have worked and haven't worked. Why we are so lucky to be able to have a conversation with the vaccine champions today. I'm going to introduce them. The first one is Vinette Tyme. Vinette is the Director of Caregiver Engagement at Houseworks. And in this position, she oversees a team of caregiver engagement specialists who help Houseworks to foster an engaged and empowered workforce. Now, that's a lot of great words. What does that mean? We'll have a chance to actually ask Vinette and Marcia about their role and what they do. But before she came to Houseworks as a caregiver and then got promoted to the Director of Caregiver Engagement, she had a 30+ year career in Jamaica in customer service. And as we know, those skills in customer service really translate very well to caregiving. She also has been recognized in her leadership as a caregiving professional. She was interviewed by NBC 10 and the Boston Globe about her virtual dementia training, and she's been awarded the Star Award from the Massachusetts Home Care Alliance. So kudos to Vinette. Next, we have Marcia Greenfield. Marcia is a caregiver engagement specialist and certified dementia practitioner at Houseworks. She helps to coach caregivers for success when working with home care clients. So again, this team of caregiver engagement specialists are really there to support the caregivers and be a resource for them. They're former caregivers, and so they're trusted by the caregivers. And like Vinette, Marcia brings a 30+ year history of working in a different industry. So in Jamaica, she worked as a school administrator, she was a court accountant, she served across multiple departments in the sugar industry, and transitioned to home care, where she's also been recognized for her virtual dementia training and was recognized for her customer service through this award of employee in customer service for 6 consecutive months. So Houseworks selected Marcia and Vinette to serve as their vaccine champions for their agency, and let's take a moment now and review what they told us about what they saw when they interviewed caregivers and when they talked to caregivers. They described 5 categories of vaccine readiness. So of course there were those people who were like, no, never, stop bothering me, I don't want the vaccine, right? That's like the hell no people. And then there's no, not interested, I don't want the vaccine, but they seem to still be seeking more information. Then there are the people who were not interested because they were just terrified. And then the people who were kind of interested but not really sure, who were seeking more information. And then of course there were a whole group of people who just lined up as soon as the vaccine was ready. They didn't need any convincing. They had been waiting for the vaccine and they wanted to be vaccinated. So the majority of people they interacted with fell into 2 and 4, the ones who were information seeking. So they said they weren't interested, or they said they weren't sure if they were interested. But the thing that tied them together is that they were seeking more information, and that creates a really exciting opportunity to intervene. And so with that, I'm going to stop sharing my screen and see if our friends, yes, I see Marcia. Is Vinette with you as well?
How are you?
Wonderful. Okay, we can hear you loud and clear. Welcome back. I can see you both. You both beautiful on this fine Thursday morning.
Busy.
I believe it. I believe it. Well, thank you for joining us today. And what I'd like to start by doing is having you talk a little bit about your roles with the caregivers and why you think that you were able to build trust with them before you started working as vaccine champions.
I think the reason we were able to build trust was that we were caregivers first and foremost. So we worked with most of them, and over the years before we got this this position, and they got to know us as a person. We, apart from the job, you might interact and, you know, every now and then, and they found that out. So they trusted. Also, during the heights of the pandemic, a year and a half ago or so, I was really at a building, a facility that we have cases, and there's an office there. And I was there like every day during the pandemic. And they saw me, went to the apartments, just called them, just, you know, just walked the building to see if I could see them. And, you know, it was a very tense moment, but I was there for support. So, because at that time, the head office was closed, people were working from home. So I think that is why they decided that, you know, whatever we say, it can be trusted. Our word can be, you know, they can trust us.
And also was a strength of support for those caregivers who actually got the COVID. Being there for them right through the time, the way we relate to them, gave them that confidence in us to believe in us and trust our words.
Yes, I had several who were quarantined because they got exposed, and maybe for 10 days, or they had to sit out the entire time. And every single day I would call them to see how they were doing, every day during their quarantine period. And those who got the virus, I followed up with them, and they had to do a test before, get another PCR, and I was there all during that time.
That's incredible, actually. What I hear is a genuine concern about the caregivers, and that through your actions and through your outreach, people knew long before the vaccine came along that you had their best interest at heart. Which it's, as in our conversations before, you underline that as a really important prerequisite to being effective when it came to reaching out about the vaccine. Mm-hmm. So I'd love for you to, I'm gonna ask you to talk to us about the case when you have a caregiver who says, leave me alone, I'm not interested, stop bothering me about this stupid vaccine. Because we're going to do a role play with one of the information seeking, you know, caregivers, someone who's not sure or who doesn't want it. But a lot of people have caregivers on staff who are it's like a dead end to the conversation. How did you approach those individuals, and what recommendations do you have for agencies who are facing a subset of caregivers who are just appear to be closed? Is it hopeless? What can they do?
What we use now is statistics.
No, before, what we did was listen to their concerns. First and foremost, you have to listen to them. Mm-hmm. Don't beat them down. Don't say, oh, or whatever. Just listen to them and hear them out. Let them vent. And then we take it from there.
Give them the facts.
You know, we give them the facts, right? But to get them to move from where they are to where we want them to be, you have to listen, and you have to be, you know, show a lot of empathy, and for them to see that you're not telling them that they're stupid to be believing this and what, and then, you know, we take it from there.
And you're not forcing them to do it.
Mm-hmm.
In recent times, what we use is statistics, showing them before COVID, we used to have like 10, 15 people testing positive before the vaccine, I'm sorry. Now, all that is gone. We're still doing testings, and we're not getting, because majority of the people are vaccinated. And those that we are testing, we are not getting any positive right now.
That's compelling, actually. So understanding that the cases have gone down since vaccination started. It sounds like that has helped. Okay. When you reached out to caregivers, why don't you describe how you approached it? We learned yesterday that you would sometimes meet one-on-one with people when they came in for testing, but that the majority of your outreach was by phone. Tell me, how did you decide who to call? How did you approach that phone call?
We knew we had to reach all the caregivers. So we started with the ones who we knew or had acquainted with, you know, we have spoken to them before this. Not that the first they're hearing from us. We talk to them, you know, because our role, we have to communicate. But there are those that we have to now, they hear from us more than ever. So those are the ones we reach out first. And then, you know, the conversation, a phone call, hi, how are you? Introducing ourselves again, and tell them what this call is about. We just don't go straight to the point, what it's about. You know, hi, how are you? How you doing? How is your day so far? Fine? Nice. You know, you start by asking, have you decided on getting the vaccine, and what are your concerns if not? And then they'll say, and then they start, and we listen, and then we bring the facts to them.
Sometimes I say to them, did you have a reaction after you take your vaccine? And they'll laugh and say, I didn't take it as yet. And it starts a conversation.
That's a great entree, actually. That's wonderful. Did you find that for people who initially were hesitant and then decided to get vaccinated, was it just one conversation? You know, you pick up the phone, you call, and then they change their mind, or how did it work out over time?
3, 4, 5 times. You know, you have one conversation, you see this is not getting anywhere at the moment, or, you know, they start getting erratic, you know, tense and you know, everything. You just say, okay, I'll get back to you. And you give them a few days in between, or sometimes a week. And then, you know, you'll call them back.
Sometimes they call.
Yes, sometimes they call. They want to know something. They heard something. So they want to confirm if it's true, or it's something about the vaccine. Is it that people are dying when they get it? You know, all that they see on and hear on the social media. So they may get back to us, or we get back to them. And, you know, and sometimes it's one conversation, questions. The second one, questions. The third one, questions. And then the fourth one,
think about it.
I'll think about it. Okay. And then they will call you back and say to you, can you tell me where I can go?
Can you make an appointment
to get
for me?
Vaccinated? And they expect us to make that appointment. And even if we are out of sight, you know, that were willing to take us, but because of their hesitancy, you know, those easy way to get into to get vaccinated, not there anymore. We have to ensure that we find somewhere to send them, and we cannot delay. We just, they're expecting us to make it happen.
One of their main fears was that it messes with your DNA. That was one of their main fears. And then we were able to convince them with the facts that we got, because we told them that we do these workshops where we get all the facts about the vaccine. And when we present it to them, somehow they take it, they believe, they have a change of mind.
Okay, and by workshops, do you mean the training sessions we did?
The training sessions with you.
Okay, okay. So why don't we, thank you for sharing all that context. Why don't we switch now into the role play? So Vinette, or Marcia, are you going to be the hesitant caregiver again?
Yes.
Or, all right, since you're together, let's see, why don't you try looking at each other and see, we can see how that works. All right, and tilt your camera down, your camera a little bit down. Okay, perfect. All right, so let's get started. I'm gonna go on mute. Imagine the phone is ringing, ring, ring, ring.
Hi, Marcia. How are you doing?
I'm good. How are you today?
I'm good. I'm Vinette, Director of Caregiver Engagement.
You're back again?
Oh, yes. Oh, sure. I like talking with you. I learn from you. You learn from me. We learn from each other. How are you doing?
I'm here, still thinking about what you said to me last week. Is there any added information you have for me?
What exactly or specifically you want to know? Because there's so much to know.
Yes, even recently, I'm really concerned about this vaccine going in my system, messing with my DNA. And even recently, they told me, I heard my kids talking that it will make people turn into zombies.
I'm gonna interrupt you with the zombies for a minute, just because I can't see your beautiful face, Marcia. Okay, perfect. So just if you scoot over a little bit, Marcia is cut off. There you go. All right, thank you. Okay, please, zombies.
I really don't want to put anything in my system to mess with my DNA.
I do understand your concerns, and I know that persons have that genuine concern, but I'm here to let you know this vaccine goes nowhere near your DNA.
How do you know that?
It sends a message, right? And it is outside. You have the cells, it's outside. Your DNA is in the center here, and it's around. It sends a message so that whenever the virus gets in your system, your body will respond to it. It goes nowhere near your DNA. It does not mess with fertility, your bloodstream, nothing. Your DNA, it's like here, and nothing goes there. It goes around it. And also, why do you think it would make you into a zombie? I have taken it. Am I a zombie? I'm speaking to you
How
now.
long have you taken it?
I took the vaccine way back in January. Initially, when it came out, I took the vaccine, and I am feeling okay.
You feel nowhere different?
Nowhere different since I took it. The first time I took it, of course, the area was a bit sore, understandable, and I got a bit tired the following day. Tired, I just wanted to lay in bed.
But my friends send me pictures of people that takes it and their face is swollen, they get sick, they have all different symptoms.
Okay.
And I've never heard about it on the news that it doesn't trouble your DNA or anything like that.
The news said it, but sometimes we do not listen for that. But it is in the news. But because of the social media, we get carried away. When you say now that your friend said that it messes up persons, and so on, have you had any proof?
Just the pictures that they send me through social media.
You know, we can doctor the pictures to make people think what they are. It is time. I am telling you, let me say something. Sometimes we need to educate ourselves. and make informed decision. Read. What you don't understand, you speak with someone who is more knowledgeable than you to explain it.
That is true, but since this virus came about, how is it possible that a vaccine could come in such short time?
This vaccine they have been working on this vaccine since the SARS, which is like in early 2000, because the coronavirus, it's a family. You see the different spikes and so
But
on.
I never heard of this before.
SARS, have you heard about that?
Yes, I do.
It's part of it. The flu, it's a virus, but it has different spikes, okay? The coronavirus currently is one of them. They have been working on this vaccine since early 2000. Government has never invested so much resources, human and financial resources, in the manufacturing of a vaccine.
Yes.
So therefore, because of that, things have moved much quicker than expected because of the research that has been going on. And listen, it's not like 20, 30, 40 years ago when they were making vaccine. We have to know that things have changed. Technology has improved. People are doing research more in a different way than it was done 30, 40 years ago when we were kids.
Yes, Vinette, but you know what? This government is on a plan to do depopulation. And I understand that this is what this vaccine is all about.
And I understand your fears, because it was observed some time ago that, depopulation by the use of vaccine in, the poorer countries. But I don't think that's happening now, because people are now more open. We have the facts presented to us. And why would they want to depopulate a generation then? And every color possible has been getting the virus. They have been dying all over the world. So why would are they saying only us that are to get it? No. It's all over.
But you said you get the vaccine in January, but I notice you're still walking around with your mask.
Sure. I have to wear my mask because we do not know enough. How long will the vaccine work? Of course, it's new. And with everything that is new, it takes time. I have to wear it because I might be able to get the virus, but hopefully I will not be able to spread it. And if I even do get the virus, you who have not yet been vaccinated will get it in a much more serious way than if I got it who is vaccinated. We have to keep wearing the mask until we are sure 100% that we do not need it. But because it is still a possibility that we will get it.
So if I take the vaccine, I'll still get the virus?
You may. I am not telling you you're going to get it, because it's not so that you have to get it, because you very well may not get it, even if you take the vaccine. I have not gotten it. I have taken the vaccine. But the thing is, if I am vaccinated and I get the vaccine, if I'm vaccinated and I get the virus, then I will not end up on a ventilator.
Okay.
But if you who have not gotten it, then you may end up very sick and may end up dying. So it helps, it averts. There's no vaccine that is going to say you will never ever get it. You take the the flu shot yearly, right?
Yes.
If you get the flu, it's no more than 2 days and you're back to normal, and you're back to normal.
Well, with that knocking, why don't we pause there? I don't know if somebody needs you, but
Okay.
what I'm
I'll think about it and I'll talk back with you.
So I'm gonna have you pause because that was wonderful.
The knocking.
You covered a lot of different types of concerns that come up in the conversations, but I want to make sure that there's time for questions. And it's 11:37, so I just wanted to pause and create some time for questions. I know you could keep going, and I know that your conversations with caregivers sometimes lasted, 15, 20 minutes. And covered a whole range of topics, but let's pause there and just see if anyone in the audience has questions for you, not just about what you did in the role play, but they may have situations of their own where they want to seek your advice about how to handle certain situations with caregivers on their teams. So why don't we open the floor for questions? You can either raise your hand using Zoom, or if I put gallery view here, you can just unmute and unmask yourself and ask any questions. Do you have any caregivers working in your teams that are hesitant, and what are some of the things that they bring up so that Vinette and Marcia might be able to comment on approaches that might work?
Hello, this is Nicole. I was in the workshop yesterday, so thank you very much for having this second part. And these ladies are phenomenal with their approach and the information that they're sharing, so thank you very much. In the company that I work with, we work with individuals with disabilities, and we're a peer support group in Maryland. So part of the struggle that we're finding in getting people vaccinated is how to approach those with disabilities that have caregivers that may be apprehensive to getting the vaccine themselves. So would you have any advice from the individuals or the client's perspective in possibly bringing up conversations with their caregivers?
Okay. I would approach the client who has disabilities, you said, right?
Yes.
Okay. And their caregiver also has not taken the vaccine. They're apprehensive. So it leaves them open to two persons pretty much exposed to getting the virus. You're taking care of me. And what happens if I, as the client, has some underlying illnesses? You could bring that up, maybe diabetes, high blood pressure, whatever. Sometimes it's when persons get the virus, then they realize that they have underlying illnesses. So the way you can approach it is that you are pretty much open to getting it. If they don't have underlying issues, then what if they got it and had to end up on a ventilator? With their disabilities, they have some drawbacks then. So, you know, they're not, you know, and that's fine. But with that, their disabilities would be that they would not, their immune system is compromised, in my opinion, you know. So if they end up not getting the vaccine, their caregiver does not believe in getting it either and takes it to them.
And the caregiver that goes out, mixed with other family members, friends, on the bus, maybe, they're exposed.
Yes, they're exposed and comes back to them, you know, taking care of them. What could, you know, possibly happen? So people take the vaccine and you can let them know because they're very selfish. I took the vaccine because I was very selfish, because I wanted to protect myself, my friends, and my family. It was all about me. And that's the approach that we should encourage them to take. And especially the persons who have underlying illness and have the disability, so they can be protected.
They are more prone to get the virus, so they need to be protected.
Okay, so if I hear you correctly, I think you're recommending that clients can appeal to caregivers, their caregivers who aren't vaccinated, by saying they're worried about their own health and that they really want that caregiver to help them to stay safe, because they may have underlying conditions or some kind of immune issue where they are at higher risk.
Yes.
That's great. That's great feedback for Nicole.
Yes,
Thank
and
you.
with the caregiver going back and forth.
Yes.
You know,
you never know.
You never know.
Wonderful. Thank you. So our next speaker is here, but I'm just going to see if there are any final questions. Hi, Brian. Any final questions for Vinette and Marcia? Any situations you want to share? Any feedback for them on their role play? Anything at all? All right. Well, with that note, I'm going to thank you both again for your encore, literally your encore performance. And the way we show appreciation is I'm going to give you a whole bunch of emojis. Anybody want to clap? Or I think you both are amazing. I'm going to give you some hearts, give you some, let's give you some love here in the emoji world. So thank you so much for sharing your insights as caregiver engagement specialists, as leaders, and as vaccine champions. You've really been doing a phenomenal job, and we're grateful that you spent time with us today.
Yes, and we have, just a footnote, we have about 220 active caregivers, and we now have 173 fully vaccinated.
Good job.
Yes.
Well then, keep up the good work. And thank you again for joining us. If you'd like to stay and listen to a legal discussion about mandatory vaccination, you're welcome to. But if you need to get back to work, which I suspect you do.
Not kidding. You know, if we could, I would love to stay and hear what he has to say, but unfortunately, but if we could get, you know, a tape, a recorded.
Absolutely. We'll share the links with you once it's all ready to go.
Okay. Thank you very much.
All right. Thank you. Take care.
Have a good one. Bye.
Bye-bye. Welcome, Brian.
Welcome.
How are you today?
Doing well.
Great. I'm going to do a brief introduction. So, first of all, I did this last time. I am not a lawyer. This presentation by Brian is not meant to convey legal advice. He is available as a lawyer if you'd like to engage him, his law firm, or any other lawyer to get very specific advice that you follow with your agency and with your teams. This is a general presentation meant to share information, but don't take this as specific legal advice for your specific situation. All right. And with that, so it's all over the news, this mandatory vaccination, it's everywhere. And we did a survey of caregivers actually at the same agency that Vinette and Marcia are at. And I assumed that people would be against mandatory vaccination, but we found that about half of the caregivers surveyed, there were 111 caregivers surveyed, about half of them actually said they would get vaccinated if it was required. And that was surprising. So there is a role for mandatory vaccination. And luckily we have Brian Steinbach with us here to discuss that. So he is of counsel at the Labor and Employment Practice of Epstein, Becker, and Green in DC. He is, you can reach him, you see all this contact information on the screen, and we'll also receive it by email. But he's done everything as it relates to employment, labor, disabilities. Like, he has worked with healthcare related entities. He has litigated on issues related to labor. He's even litigated an arbitration issue before the Virginia Supreme Court. He's the man to go to. He knows a lot about this topic. Went to law school at UVA. He's on the National Labor Relations Board in DC. And most
No, I'm not on the National Labor Relations Board. I worked for the National Labor Relations Board.
Oh, my bad. Okay, reframe. Works for the National Labor Relations Board in DC.
It's a nice promotion, but no.
And our favorite role for him is that he is the board counsel to MINCA. So we are very pleased that he's here to talk to us today. I'm going to stop sharing my screen and invite Brian to add any additional pieces to your introduction, and then start to just share some high-level thoughts about the legal issues that are important for home care agencies to consider as it relates to vaccination, mandatory vaccination at this phase of the pandemic.
Sure. Well, I'll just jump right in with some highlights. The most important thing, I guess, is that you do have the right to require vaccinations. The EEOC itself confirmed this as something you can do, subject to reasonable accommodations of people with medical conditions or religious beliefs. And the Southern District of Texas, judge there, had very little trouble throwing out a lawsuit challenging Houston, the hospital in Houston Medical, requirement that people become vaccinated. The theory really on those who have tried to challenge these mandatory vaccinations has been around the fact that this is still under emergency authorization use. But the court said, yeah, technically that's true, but 150 million people have gotten this vaccine and it's shown to be safe and effective. I don't think so, and I think we can also anticipate probably pretty soon the Pfizer vaccine will get a full authorization. I know they said they were applying for it. I don't know if they've actually done it, but the data is so overwhelmingly positive that it's hard to believe that anything will help it and that it won't get approved. And the other thing now, most recently that's happened is OSHA came up with its emergency temporary standard, which strongly encourages vaccination, and in particular exempts from coverage of the standard if people are, at least in home health care, where employees are all fully vaccinated and non-employees are screened before entry, and people with suspected or confirmed COVID are not present. And screening is pretty minimal. That's asking the questions about fever and how you feel and that sort of thing that have been used for screening from the beginning, taking temperature. It's both something you can do, something you probably ultimately want to do. More and more employers are starting to require it now. They weren't earlier. On the other hand, given those pitfalls and the possibility still out there of at least somebody bringing a lawsuit, even if they aren't going to be successful, shouldn't be your first step. You should do everything you can to try to encourage it first. And then, maybe, in a month or two, you can always change to something more specific. And for example, some companies that are gradually starting to come back to work in their offices are saying, okay, you know, effective September 1, everybody's going to have to be vaccinated. And we're seeing this in Wall Street. We're seeing this in some law firms. And I think, you know, eventually that may be true at a lot of employers. You know, obviously, you've got the problem that if you're the one that's requiring vaccination and some other home healthcare agency isn't requiring it, that person might decide to go work over there and you've lost an employee. You may ask if somebody is vaccinated. You know, it's not a protected class, but the information that you receive is going to be protected medical information. So you can't go sharing it out with others. And particular concern is whether or not you can share that with your clients. The client can ask your caregiver, because they're not covered by HIPAA, of course. You know, you can if you do make it a requirement for everybody to be vaccinated, you know, you acquire that information. You just don't send people out. It's a tricky little area there. Let's see. You also, of course, can still require people to wear masks as before. And you know, obviously, in the home health situation, you have people who are at risk by definition. So you're going to want to continue to tell people if they're not vaccinated, they have to wear a mask. And if you want to just cover all the bases and say you have to wear a mask when you're servicing them, you could do that too. You also have to be concerned about, obviously, the person, your client, perhaps being a carrier, having been exposed and hurting your employees, much as in the hospital situation. Let's see. One other thing I want to mention about the OSHA standard is it essentially requires you to provide some time off for and paid time off for getting the vaccine, and if there's a side effect, paying them for that time as well. That's of course an incentive anyway, and there's many incentives that you can offer to people to get vaccinated. That's the simplest and easiest one, perhaps. Charlene, you got some questions you want me to answer?
No, that was actually great. I do have a quick question about the OSHA standard you just mentioned.
Right.
Does that mean that employers are they required by law to offer paid time off for an employee to get vaccinated? Did I understand that correctly? Or is that kind of just a guidance?
It's something, I guess, I think it's more at the level of, I think it's really a requirement, but, you know, they're certainly strongly encouraged.
Mm-hmm. Okay. That's
I'd have to double check it, but let me take a look here. I think it is required, but let's see. Anyway, while I look, ask some questions.
Well, actually, why don't we open the floor to questions from participants? Does anyone who is in the audience have any questions for Brian about mandatory vaccination or other considerations as you are working with your teams around vaccination? Any questions? And you can either drop it in the chat saying you have a question, or you can just unmute yourself and start talking.
I have a question. What if a guardian asks about staffs, and let's say they say I only want a vaccinated staff member to work with my child? How would we handle that? Not in the case of mandatory, because if it's mandatory, I'm speaking in a case that it's not mandatory.
Right. It's a very, unfortunately, complex situation because it's protected health information once you know it. And an argument can be made that if you send somebody, after that question is made, you've revealed protected health information. I doubt that anybody's going to complain in that context because the person's getting the work. After all, they don't presumably don't have a problem with people knowing they're vaccinated because it's to their advantage. But your response to the client probably should be, we're not allowed to reveal vaccination status, but you are free to ask the person. Typically, don't they interview the person before taking them on?
For guardians, not necessarily, dependent on the agency, but I know we do not.
Yeah. Well, the guardian is the person who is deciding who's going to be the caregiver, right?
No, they don't decide. Usually the agency hires the staff, but they, have rights and stuff over their loved one.
Right. Once the person's there, they can ask questions, I guess. Yeah, it's a tricky situation.
Thank you. I think you answered the question. I think
I mean, other part of the response is we're happy to require the person to wear a mask, if that's your concern.
So Brian, are you saying?
By the way, I found the answer. Yes, because vaccination is a tool to reduce the presence. The OSHA standard says you must support vaccination for each employee by providing reasonable time and paid leave for vaccination, any side effects for a reasonable time, whatever that may be, as you might wonder. And for those who want to track it, it's at 29 CFR 1910.502 parens M.
Okay.
But actually, I found it in the Q&A, and actually, there's a lot of stuff in the emergency standard that you probably want to take a look at in terms of compliance. There is an exemption, as I mentioned, for where your home health and everybody's vaccinated. So that's maybe encouragement. But there's reporting, and there's you got to keep a log and all the usual stuff. And while I'm not really an OSHA lawyer, so I won't go into the details of that stuff, but I encourage you to take a look at it. Charlene, did you put our
advisory
out there for people to have?
Yes.
And there's a summary of some of the stuff there, and there's also you can go to OSHA from there and look at the standard itself.
Right. So for those of you who received the email this morning, there's a hyperlink to the advisory that Brian is referring to in the section on legal considerations. But Brian, I want to clarify your answer to Melissa's question, just to be really clear. Are you saying if a client asks about says they want vaccinated caregivers and they ask about the vaccination status of a caregiver that you send them, or say only send me vaccinated caregivers, you as the agency, the employer, cannot tell the client whether or not that caregiver is vaccinated, but the client can ask if they want to because they're not an employer. Is that, just to summarize, is that what you said?
Yeah, that's summary what I'm saying, exactly.
Okay, wonderful, thank you.
Unless, of course, your person has, your employee has given you permission to reveal that information. Because it's protected medical information, but they're the one, it's their information, they're free to reveal it or not reveal it, or consent to being revealed. You should have that in writing, probably, so you can prove it later.
Would asking for consent, could that be perceived as coercive because your work is contingent on giving consent?
Yeah, if you make it that way, yes. But if you make a general, do you have because you're able to ask them if they've been vaccinated, and when they tell you that, you can ask, do you have a problem if we reveal your status? Because at this point, it's anybody. You ask that of vaccinated and unvaccinated people to clients, and if they say no and they sign something acknowledging that, I think that would fly. I haven't actually seen anybody say that, but it is not coercive, because you're just asking them when you're asking everybody, you're not connecting it to anything or any particular job, and they've given their consent.
Okay.
So there's a chance that would fly.
All right, great. Thank you, Brian. Other questions from the audience?
Hi, it's Devon. I'm just trying to process that bit of information, because that is one of the main challenges we are facing with staffing new clients. The ones that are not requiring interviews, but are requiring vaccinated caregivers. So, it's putting us in a tough spot, because we don't have a large population of our caregivers that have been vaccinated. And the ones that are, I shared in the chat, are on active assignments already. So we can simply tell the clients, the new clients coming in, that we can't reveal that information, but we're happy to have them wear masks, and that should work.
I think that's got to be your answer. Then, if the employee voluntarily reveals to the client that they're vaccinated, that they don't have to wear the mask anymore.
So it has
Although
to
they
be
may want to wear the mask if the client isn't vaccinated.
I'll jump in there and just say that, just in general, that masks are still required in healthcare settings, regardless of vaccination status, just at this time.
Yes, we are still requiring our caregivers to wear masks, but it just that conversation around the vaccination and the status of the caregiver is where we are kind of hitting the wall, because we, at this point, if we can't staff, we're just telling the clients, unfortunately, we're having trouble finding you a caregiver that is vaccinated. But if we can omit that information going forward, I'm sure we will have, an easier way to go. But yes.
You're definitely been a rock and a hard place. And the OSHA standard says you don't have to have masks if you're in a home healthcare status situation. If you're vaccinated and anyone entering who is screened, but I don't have a problem with you continuing to require that in the healthcare situation. Certainly, generally, it's required. I guess the state probably is requiring it, and the state requires it. You got to follow that. OSHA standard makes it clear that it's not preempting anything. So, it's a complete rock and a hard place, because this is what people want, and it's perhaps points to a good reason for requiring vaccination, because it's the only way you can service your clients properly.
Right.
To say we require everyone to be vaccinated at that point.
And you did say in the beginning that we can require it, correct?
Yes. Yes. Yeah. I mean, you got to be reasonable in providing a certain period of time for people to comply. But but these days it doesn't take that long to comply.
Right.
Well, and to be fully vaccinated, you got to be 2 weeks after either the second shot, if there is one, or after the first shot. So just because you had the shot, there's a 2-week waiting period for it to take effect and make sure there wasn't something already in there. So,
right. Okay. Thank you.
And that's why, OSHA put in the, you can provide other incentives beyond simply, the time off and to get it done. As long as they're not, well, if you're doing it yourself, which you're probably not, you got to be reasonable. But if you want to give somebody a bonus for getting it, I mean, there's obviously you only have so much money available to do that with, but there are things you can do to encourage it. And I know, Charlene, and one of the prior things you talked a lot about the incentives that some people were doing.
Yeah, there are some employers are offering financial incentives, definitely paid time off. And then there are other employers, like for those of you who attended yesterday, there are other employers that are investing in efforts to, change hearts and minds about vaccination as well. And so,
absolutely. I mean, that's part of it. Getting people to talk to each other about it. And I'm speaking to the choir here probably, but that it's not just protecting you, it's protecting other people, it's protecting your loved ones, the people you have contact with, all those things. There's this variant out there now that's much more contagious and much worse. So, but vaccine does protect against it. So get it now while you can.
Brian, what about medical exemptions? Like there are some people for whom either they have a reason not to get vaccinated, or they may have an immune condition that prevents the vaccine from working in them. How should employers consider those situations?
Just as accommodation, just as with any other accommodation with respect to the ADA, if there's an alternative protection, if mask wearing and distancing works, then distancing doesn't really work in home healthcare. And you can't set it up like a hospital room. It's not practical. But avoiding wearing gloves, wearing a mask, those kinds of things, may be sufficient. May depend on the client. There's a higher risk with some clients than others, deficient individuals versus just plain sick. Recovering in short-term care, recovering from surgery or something like that may not, is a different situation. That's, but you can ask for, some evidence of the medical condition, unless you already know about it. But there's some exemption. The OSHA standard has exemption for pregnant women, although my understanding is that that's it's questionable whether a vaccine is a problem there, but nonetheless, I think that's something that's looked at. And then there's religious exemptions as well. So.
Okay. Thank you.
But yeah, I mean, when it comes back around to the requirement, remind people of all the requirements to get flu vaccinations. That's been out there for a long time, and certainly in a hospital situation. So it's nothing new to have required vaccinations.
Absolutely. Thank you. Are there other questions for Brian?
Yes, the conversations are very important because there's so much falsehood floating around out there on the internet that you can, what you can do to show that that's not true. It's not putting a chip in you. There's some pretty wild ones out there.
Yeah. Yeah, no, absolutely. We are big fans of education and trying to debunk the myths that are out there about the vaccine. Do others have questions? These are great questions so far for Brian. Other questions or thoughts or just comments that you'd like to make while we have him here?
Cover.
Okay, well, I am going to share my screen and actually ask. I actually planted some of the questions from the last time. So we had this one. So we have, I think you've covered this, but this was, we're doing a major push for vaccination. Would like to send out a letter saying that vaccination is required. If you aren't vaccinated, we understand, but your weekly hours may decrease. Is it okay to tell caregivers that choose not to get vaccinated once you make vaccination mandatory? Can you actually tell them they're not going to get as much work, or can you tell them that they won't get any work?
I like the may decrease. I think it's a good idea to say, we are open to reasonable accommodations for those who cannot take vaccine for medical or religious reasons. We will consider, reasonable accommodations. So you're not cutting it out completely.
Okay, that's fair. The next question, this is the question that's already come up. It came up last time, it came up this time. It is a very popular question because
yes.
every federal agency is getting questions from clients and prospective clients about the vaccination status of their caregivers. So it's not surprising that the two questions we've had so far really focused in on that.
Yeah, the home health care is sort of an outlier when they think about these rules. They, in a hospital setting, it's just not an issue. But or for that matter, even in long-term care facilities, it's not really particularly an issue. But here, they don't really think through what the workplace is really like. I mean, the workplace is someone's home by definition. Well, almost always, because sometimes you're providing care in a assisted living facility, which is still a home, but it's a little bit different. But maybe they'll think of it, but EOC is always re-looking at these things, but there's unfortunately quite a time lag on it, and I think there's a strong reluctance to open any holes into that protected health is protected health situation, except where it's needed for care, and maybe that's the argument, that in order to provide the care, it's necessary to reveal it. But that's, you take a risk when you do that, and I'm not saying you got to make your own decisions there.
So the court case you mentioned in Texas, where the judge dismissed the lawsuit from a bunch of employees at Houston Methodist Hospital, does that mean that we're done with lawsuits and everyone is?
Oh no, by no means. And in fact, they're going to appeal that decision. Okay. And there are other lawsuits pending in other places. What it means is that there's a really good decision for the other judges to look at and consider, that I may reject some of the reasoning, and it may depend on the facility, but it's a great start. It's a real smackdown. It's kind of like the NCAA decision this week. You're in trouble now. And I saw some numbers today. I mean, the vast majority of the Houston facility, it's a huge operation. Something like 98% of these people have gotten vaccinated anyway. There's a few hundred that have chosen not to get it, and I mean, they had I guess they'd given everybody, put them on suspension for 2 weeks, give them time to get vaccinated if they hadn't, and that 2 weeks has expired now, so they're actually losing jobs. It'll be interesting to see how Texas unemployment handles those.
That is actually interesting. Yeah. Can you get vaccination and then lose your job and get unemployment?
Right. I mean, it's your own fault that you lost the job. It's not no fault of your own, unless, of course, you have a religious or medical reason for not getting it. So, and Texas, I don't think is a state that probably hands out unemployment all that easily, you know, unlike some other states, like New York.
Very, very interesting. It's a really interesting time as we think about these issues and the challenges that employers are facing as they consider vaccination, as they consider mandatory vaccination. Brian's time with us is up, and so I just wanted to make one more offer. If you have a last minute question for Brian before we let him get back to his law practice, this is your moment. We'll give it, you know, a good 30 seconds, 20 seconds, and, you know, going, soon to be gone.
All right, well,
I think your answers were so clear.
sure. Obviously, those of you who are MINCA members, some guidance gets posted there from time to time that I don't necessarily generate, but my colleagues do. So feel free to, you know, if you're not a MINCA member, you should become one.
Don's gonna love that plug.
Well, I got to do that for Don.
That's wonderful. Brian,
right.
Thank you so much for sharing your insights with us and your time. We are grateful. Have a wonderful day as a labor and employment attorney, and we'll be in touch.
All right. Take care.
Thank you so much. Bye-bye.